Hello everyone, am I visible? Am I audible? Can someone respond in the chat box? Let me open the chat. If I'm clearly visible, audible, I will start the session ahead. People are still joining. We will wait for a few seconds. Thank you. Thank you, Tanu, for responding. Thank you so much. So let everyone join. Wait for a few more seconds. We have changed the link now. Tech team told me that it was already many hours now. So the link expires. We have to create another link. That's why we have changed the link. Anyways, we will start in just few seconds. Sorry for delay for that. I guess we have started community medicine. We have started chapter 1 in community medicine, health and disease. Okay, we have already completed health. We have started disease. In the disease also, we have seen the definition, the differences between disease, illness, and sickness. Okay, we have already seen that. And not only this, we have seen the natural history of the disease. We have seen the iceberg phenomenon. We have already also seen the differences between disease control, elimination, and eradication. I explained you the three definitions very well with the help of epidemiological triad. Okay, can we continue now? So after that, the next topic which I want to continue here is the levels of prevention, ultra important topic. So I will be starting the levels of prevention round. Okay, so there are 4 levels of prevention in community medicine: primordial, primary, secondary, tertiary. Let me explain you the differences between them. You always and definitely get a question on that. Please mind, it's very important topic. Please understand. Please understand, there is a person who is leading a normal life. Imagine there is a small child, 5-year-old child. There is a small child, है ना? There is no risk factor in the life, है ना? When the risk factor is coming, for example, there is a child and the father of the child is counseling the child ki beta don't smoke. So child is saying, daddy, I don't smoke, papa, I don't smoke at all. So the father is saying, yes, I know you don't smoke, but in future also you don't smoke, right? I'm reinforcing this thought that in future also you don't smoke. Smoking is a bad habit. It leads to many diseases. It leads to cancer. It is having multiple bad effects on the body, right? So when the risk factor is absent and before that someone is taking the prevention, it is primordial. So this is an example of primordial prevention. A dad, a father who is counseling the child who don't smoke and reinforcing the thought of not smoking. But smoking hai nahi, the risk factor is still absent. Before that, you are counseling the person don't smoke. So without the appearance of the risk factor, before the appearance of the risk factor, the counseling is done. That is the primordial level of prevention, and that is the best prevention. Mind my words, these are the best prevention. Got it? You got it? Say yes. Now imagine a person who smoke. Smoking is a risk factor and it leads to lung cancer. So smoking is present, but lung cancer is not there yet. The person smoked from years chronically. You are counseling that person now. You are counseling that person that kindly quit smoking. If you don't quit smoking in future, you may have lung cancer, you may have emphysema, you may have chronic bronchitis. There are multiple diseases which occur due to smoking. So please quit smoking. So risk factor is already present, but the disease is absent. So before the appearance of the disease, but after risk factor, you are doing the counseling. This is known as primary. So there is a difference between primordial and primary. Primordial is before the appearance of the risk factor. See, here you are doing the counseling. And primary is after the appearance of the risk factor, but before disease. How many of you got this? How many of you got this? Now imagine a person who already have the lung cancer. Unfortunately, the person already have lung cancer, but it's stage 1 or 2. It's early stage. And metastasis is not yet, complications are not yet. You are counseling that person, please take early treatment. Do the diagnosis, take the chemotherapy, take the radiotherapy, and do the surgery as soon as possible. So what you are doing? You want to hold the disease. You want to withhold the disease in early stage. You do not want the person to lead into complication. So you want to limit the disease. Disease is already there. Hannah, you cannot stop it now. Disease is already there. But the thing is that by early treatment, you can stop it at early stage. So after the disease, if you are counseling someone, you are doing secondary level. Secondary level is always regarding diagnosis and treatment because disease is already there. Now there is no use of quitting the smoking. You always talk about the early diagnosis, early treatment. Hana? So that is secondary level of prevention. Disease is already there, but in early stage. Now imagine a person who already have the lung cancer and it's already metastatic. It's already stage 4, multiple complications are there. Now you can do nothing. The only thing you can give the palliative treatment and give a quality, increase the quality of life in the person as much as you can. है ना? So that is tertiary. Tertiary care is palliative care, that is rehabilitation, that's it. So that is tertiary level of prevention. So what are the 4 levels of prevention you can see? So let me write down. There is a normal life. है ना? The normal life is going on. There is no risk factor in that. After that, the risk factor comes. Risk factor is smoking. That leads to the disease. But first, early disease occur, and then advanced disease or complication of the disease occur. Okay, and finally the complications occur. So if you are giving a suggestion before the appearance of risk factor, that is primordial. This is primordial. Before the person starts smoking, enhance the thought that you don't have to smoke in future also, right? That is primordial, the best one. After risk factor but before disease, someone smoke but don't have lung cancer, you are asking the person to quit smoking, you are doing primary level of prevention. The person already have the disease, but in early stage you are asking the person to do early treatment. You do the early diagnosis and treatment, you are doing secondary level of prevention. And after the disease happened, and before the death of the person, you are doing anything for the person, like you are doing the rehabilitation, any type of rehabilitation, that is tertiary care. You got it? Can we go ahead? Yes, I'm repeating again, Navjot, I'm repeating again. So I'm telling you the levels of prevention. I told you there are 4 levels of prevention. First, learn the 4 levels of the prevention: primordial, primary, secondary, tertiary. Please understand the meaning of that. Hana, please everyone see on the screen. There is a normal life going on. Okay, you all see here. There is a normal life going on. Hana, there is a child. Imagine a small kid is there, a child is there who don't smoke. Of course, child don't smoke. He's a 5-year, 3-year-old child, and the father is asking the child, "Beta, don't smoke." The child is saying, "Daddy, I don't smoke." So the father is saying, "Yes, I know you don't smoke, but in future also you don't smoke." So before the risk factor appears, you are doing the counseling, the best counseling, the primordial. So primordial is always before the risk factor appears. Now imagine a person who smokes but who don't have lung cancer yet. Disease is not there, but he's a chronic smoker, 25-year-old male, smoking since years, 1 packet, 2 packet every year. So you are asking the person, please, why don't you quit smoking? You should quit smoking. Smoking is not a good thing. It can lead to many malignant diseases as well as benign diseases. It can lead to lung cancer in future. Kindly quit it. So what you are doing? You are counseling someone after the appearance of risk factor, but before the disease appear. So this is primary level, the second best. This one is the best. This is the second best. After this one is good. Primary level. Here the risk factor is already there, but disease is not there. Imagine a person who already have lung cancer. The person have lung cancer, but it's an early stage, stage 1 only, stage 2 only. It's not metastatic. So you are asking the person, why don't you take the treatment as early as possible? Take radio, take chemo, take the best treatment, do the surgery, do the diagnosis. So it is always regarding diagnosis and treatment. Disease is already there. Now you cannot stop it, but you can halt it. Halting can be possible by secondary prevention. You do early diagnosis and treatment. Okay. But imagine a person who already has stage 4, the metastatic lung cancer. It's already metastatic. Now, death is certain. You cannot do anything. The only thing you can do the rehabilitation. So rehabilitation is basically tertiary. So diagnosis and treatment is secondary. Rehabilitation is tertiary. Before the appearance of risk factor is primordial. After the appearance of risk factor, but before disease is primary. How many of you got it now? Now, Jyot, you got it. Others, you got it. Everyone got it. Say yes. The 4 levels of the prevention. You always learn. Okay, the same thing is shown to you. Where does the vaccine will come? What is vaccine? Okay, let me ask you other way. Are you all vaccinated? You will say, yes, ma'am. You are vaccinated for what? Are you vaccinated for polio, OPV? Yes, you are vaccinated for D, P, T, MR, multiple diseases. So what do you mean by that? What do you mean? It means that the OPV is caused by polio virus. It's already present in the environment. Diphtheria is caused by Corynebacterium diphtheria. It's present in the environment. Tetanus is present in the soil. So the risk factor is present. The agent which is causing the disease, it's present, but we don't have the disease yet. So before the disease occur, but risk factor already present. So this will come in primary level of prevention. Vaccines will come in primary level of prevention because risk factor is present, but disease doesn't occur. I'm vaccinated for polio. I don't have polio. So before the disease, I'm vaccinated, but polio virus is present everywhere. So risk factor is there, but disease is not there. So it is at that level we are giving the vaccine. So vaccine, all the vaccine, jo bhi vaccine bol lo duniya ka, all the vaccine come under primary level of prevention. Learn. It's an example. Say yes. Got it? How many of you got it? Hannah, please understand that. Hannah, let me ask you what is screening test. I told you, screening test. For what people we perform screening test? The iceberg. Remember the iceberg I told you, the hidden portion of the iceberg, the submerged portion of the iceberg. What is that iceberg? They have the disease, but they don't know they have the disease because the disease is asymptomatic in them. They feel they are healthy, but actually they are not healthy. For them, we are performing screening tests. So, but screening tests we are performing for the people in which disease already started, but in early stage. Can I say disease already started in the person, but person don't know the person is have disease because it's an early stage. The symptoms are not there. So can I say it's disease already started, but before it advances, we are doing certain intervention, the screening test. So screening test is an example of secondary because the disease already started. So you don't have to understand, you don't have to like learn, you have to understand the concept. Got it? So tell me the 4 levels of prevention. What are the 4 levels of prevention? Primordial, okay, just a second. Oh, let me open the Telegram chat also. Some people are responding here, some on Telegram, so both the chats are in front of me. Okay, primordial, primary, secondary, and tertiary. These are the 4 levels of prevention. How you define them? Risk factor present or absent, based on that, disease present or absent, and the advanced disease, that is complication present or absent. So if risk factor he absent hai, of course there is no disease, no complication, so it is primordial, before the appearance of risk factor, before disease, before complication. In primary, the risk factor is present but disease is absent. Got it? That is primary. In secondary, the risk factor present, of course, the disease is also there. Patient also have lung cancer. Okay, patient also have smoking, but complication is not there. In tertiary, risk factor is there, disease is there, already the disease is advanced. So in this way, you can learn, you can see I'm increasing the level. So this is primordial, primary, secondary, tertiary. How many of you got it? How many of you got it? Okay, so I taught you the 4 levels of the prevention. Now let me tell you the levels of intervention. For all of them: primordial, primary, secondary, and tertiary. For each of them, how to perform this. So if you want to perform primordial prevention, what are the 2 ways? Primary prevention, the 2 ways. Secondary prevention, the 2 ways. And tertiary prevention, the 2 ways. We have two ways. These are known as mode of intervention. How we actually perform the prevention. So first tell me the level of prevention. Is it primordial, primary, secondary, tertiary? And then tell me the intervention. If it is primordial, what is the type? Primary, what is the type? So let me enumerate the interventions now. Primordial, what I told you, primordial is by always counseling. You have to counsel the kid, counsel the child, better don't smoke in future, like that. So it can be done by 2 ways. Either by individual education, you are educating an individual person, like the kid you are educating. I say to my kid, better don't smoke in future. The kid say, mama, I don't smoke, so in future also you don't smoke. That is individual education I am doing. Or we can do a mass education, that is on television also the same message is shown, on radio also. So there are many advertisements, many good messages conveyed on the television, radio, internet. So not only one person, the complete mass community that is educating before the risk factor appears. Government do so. So there are 2 ways of primordial prevention: individual education, one-to-one person, and mass education. That is, a group of people can be educated together via television, radio, newspaper, like that. Okay, internet, like that. What are the 2 ways of primary prevention? Primary prevention is it can be non-specific or specific. It can be health promotion, and specific protection. These are the 2 ways. You will say, ma'am, what does it mean? Health promotion, specific. Health promotion is non-specific. If I say eat a healthy diet, because nowadays nutritional deficiencies are very common, and someone can have nutritional deficiency and can have the disease. So nutritional, because of the stressful life and busy life, we don't eat like good food, and we are very hurry, we don't give time to the food. So risk factor is there, but disease is not there. Currently I don't have any nutritional deficiency, but there is a risk factor in future I can have because I'm having a busy life or whatever. So eating a healthy diet will prevent me overall all the diseases. It is non-specific. I'm not talking about anemia, I'm not talking about vitamin A deficiency, vitamin D. If I eat a healthy diet, all these diseases. So it is non-specific. If it is non-specific, it is health promotion. But if I say vaccine, if I say vaccine for polio will give me only for polio protection. Diphtheria vaccine will give me only for diphtheria protection. It is specific. It is specific for that disease. It is not for all. So it is specific protection. So vaccines will come in specific protection. Particular vaccine will give protection for particular disease. That I mean. If I say there are mosquitoes at my home, so I know mosquito se kya disease ho sakti hai. I can have malaria, I can have dengue, I can have chikungunya. There are many diseases which occur because of mosquito. So in the night before sleeping, I apply a net around my bed, and then I go to sleep so that mosquito don't bite me. So risk factor is present at my home. Mosquito is present, but because of the bad net, this is my bed, and applying a net on that, and I'm sleeping after that. So I'm covering myself with the net, everywhere. So it will protect me with not all diseases. So bed net will give me protection only for mosquito-borne diseases. So bed net will again come in the specific protection. It is primary because risk factor is present. Mosquitoes are present at my home. You got my point. So you have to understand like that. Vaccine, immunization will come here. Bed net will come here. Specific protection will give you protection against that particular disease, not overall. Got my point? है ना? If I say before eating you should wash your hand, है ना? So the risk factor is present. Your hands may be contaminated with the bacteria, virus. So risk factor is there. But before you have the disease, you wash it. So it is a primary level. But hand washing will not give me protection for any one particular disease. It will give me protection for all the diseases. So it is a health promotion. So healthy diet, hand washing, this is health promotion. है ना? Good lifestyle, that is a health promotion. But vaccination, bad net, है ना? If I should eat good iron in my diet, so I will not have anemia. है ना? So that is specific protection. How many of you got it? Coming on the secondary level. What is secondary? You tell me what is secondary. Give me a minute. What is secondary level of prevention? In the secondary level, you say, ma'am, the disease is already present, but in early stage. It is not advanced stage, but the disease is present. So you can do early diagnosis and treatment. The two ways. Either do early diagnosis or do early treatment. These are the two ways for secondary prevention. And what is tertiary prevention? You will say, ma'am, in tertiary prevention, the disease is already advanced. Now death is certain. We can do two things. है ना? We can do repair and we can do rehabilitation. How much you repair, otherwise do rehabilitation. That's it. So learn two total 1, 2, 3, 4, 5, 6, 7, 8 ways of the intervention. Two for each level of each level of prevention. So for primordial prevention, we have individual education and mass education. How many of you got this? How many of you got this? For primary prevention, we have health promotion and specific protection. Health promotion is non-specific. Specific protection is specific. I told you that. After that, I told you for secondary, it's diagnosis and treatment. Early diagnosis and treatment. And finally, for tertiary, we have rehabilitation and repair. Can we go ahead? Anyone having any doubt? So I will give you, now I am going to ask you 30 questions one by one. You have to tell me two things in each question. Number one, first tell me the level of prevention. Whatever example I am giving you. Is it primordial, primary, secondary, or tertiary? And in that particularly in that mode of prevention, what is the level of intervention? What is the level of intervention? Let me ask a question. Are you all available on the Telegram group we have made? Are you all people available on the Telegram group? Is it convenient for you to reply on the Telegram? Because reply is fast there. On the app, there is a little bit lag. It's okay on the app also, but better on Telegram because it is very fast. The instant I give the question, you give the answer. Okay, is it good? So read the question and give me two answer for each question. Okay, Ji, on the app. Okay, the one who are comfortable on the app, give there. Wherever you are comfortable, give answer. So let me read the theory first, then I will give you questions one by one. Okay, listen. Primordial level of prevention. I told you what is primordial. It is the prevention before the emergence of the risk factor. Before the risk factor comes, it is the best level of prevention. So discouraging to adopt a harmful lifestyle like smoking in a kid. It is an example of primordial. It is having two modes, individual education, mass education. We have seen the example of both of them. Okay. Primary level is after the risk factor, but before the disease. The risk factor is present, but the disease have not yet taken place. So you are taking action prior to disease, but after the risk factor. This is second best. Here also I am having two things with me. Health promotion, that means non-specific, and specific protection, naam mein hi hai, that is specific. So see the example of non-specific. If I say lifestyle modify karo, you modify your lifestyle. You get up early in the morning, you do physical activity, you have a healthy diet, you hand wash. So that will prevent you from all the diseases, not from one disease. Environmental protection, dietary modification. So from all the diseases, non-specifically you are protected. But if I say immunization or vaccine, the particular vaccine will give you protection for that particular disease. Diphtheria vaccine will give you protection for diphtheria, not for polio. That I mean. Okay, the same for chemoprophylaxis, same for fortification of the food, supplementation, uses of condom. Condom also come. So in the condom, we say during sexual intercourse. Sexual intercourse is a risk factor. So sexual intercourse is present, but pregnancy have not yet taken place. So after sexual intercourse, I mean during sexual intercourse or before the pregnancy taken place. So it is a primary mode of prevention, but using condoms only pregnancy is prevented, not other diseases. You got disease. Pregnancy is not a disease, but we are comparing here. Okay. So usage of condom will also come in specific protection way of primary protection. Okay, Ji, can we go ahead? The next is the secondary level of prevention. Here, the disease already occurred. It's already occurred, but we want to halt it at early stage. And we want to prevent the complication. We want to arrest the disease at early stage. At early stage. So that is, so we can do by two ways, diagnosis and treatment. Early diagnosis, early treatment. These are the two ways we can go. Okay. All the national health programs work at secondary level of prevention. Okay. And tertiary, it's already the disease have its complication. Anna, not just you want to reduce or limit the disability and minimize the suffering. You want to give palliative treatment. So two things are there, rehabilitation and disability limitation. That's it. Anna, for example, there is a person with polio. You are providing crutches. You know what are crutches? You are providing crutches. Crutches यानी चलने के लिए सहारा है ना to the polio person. You cannot treat the paralysis. लेकिन चल नहीं पा रहा तो कम से कम you provide the crutches. He can walk. है ना? You do reconstructive surgery in the leprosy. You provide school for the blind. The persons are blind, but there is a separate school for blind. है ना? You provide schooling to them. है ना? So there is rehabilitation. Got my point? How many of you got it? So can I say that primordial is before risk factor? Primary is before disease, after risk factor, but before disease. Secondary is after disease, but before complication. And tertiary is after complication. How many of you got it? Say something. Yes, no, but respond. Give me a gesture. You can see my face. Well, I can smile, I can do, but I cannot see you. In front of me, there is one camera and your chat box. That's it. So please respond. Keep on responding. Vaccination is primary. Vaccination, immunization, AMU is one and the same thing, by the way. Vaccination, immunization, एक ही बात होता है, AMU. So both of them are primary, not secondary. Okay, screening test is secondary. Screening test is secondary. Got it, AMU? Can we go ahead? Others? Yes. Okay, can we go ahead? Okay, good, good. So you will tell me the examples, answers. So I will ask you 15, 20 questions one by one. The first question is in front of you. Let me interpret the question. Then you give the answer. Let me read the question. You have to tell me two things. What is the level of prevention? Primordial, primary, secondary, tertiary, चारों में से क्या है? What is one of the answer? And whatever is your level of prevention, tell me the mode of intervention in that particular. You have two types of mode of intervention in each of them. So you have to tell me which one. Okay, let me ask. Okay. Medicine is the treatment. Now, Harsh Patel, you are asking medicine will be primary. Medicine is treatment. You give treatment after disease occurs. So I think it's secondary. Medicine is secondary. Medicine means you want to treat the patient. No, treatment you will give only the diagnosis is there. The disease is there. Okay. Okay, Ji. Can we go ahead now? Okay. So listen, there is a patient having fever and cough. Oh my God, fever and cough is present. The patient already have the disease. Now you think what is the level of prevention you want to say. The patient already have cough and cold since last 3 weeks. And the patient is going to the DOTS clinic now for AFP sputum. है ना? AFP sputum, acid fast staining sputum. So what is the level of prevention? Yes, you all are right. Absolutely right. Everyone is right. It's secondary level. Secondary, maybe we have two things, diagnosis or treatment. What do you say? Is it diagnosis or treatment? You have to tell me the mode of intervention. Come on, also. Not only level. Level of prevention is secondary based on cough and cold. My answer is secondary. In the second, it's not tertiary, Tanu. It's secondary. The person have fever and cough. That's it. Not the complication. Okay, so it's secondary. The person have the disease, but it's still in early stage. Okay, and person is doing the diagnosis with the help of sputum. So in the secondary level of prevention, the mode of intervention is diagnosis, not treatment. Abhi treatment nahi le raha hai, sirf diagnosis is happening. So I will say my answer is secondary level of prevention and it's diagnosis. The mode of intervention is diagnosis. Give two answer in each question. Okay, you all are right. Very good. You got my point. The next question, the same question, a little bit changed. Listen, again the same patient who's already having sputum positive AFP. So the person is diagnosed case of TB. Sputum positive hai uska AFP ke liye. The person already have the TB. So is it secondary level? No, it is secondary. The person is already sputum positive TB. It is written in the question, category 1 TB. And now the treatment is given. Now the treatment is given with intensive phase drug. So this time also secondary, but this time we are giving the treatment. Yes, secondary treatment. Very good, very good. You all are right. You all are so smart. So secondary, but this time we are giving the treatment. The next question. There is a patient with fever and chills. Oh my God, fever and chills are there. It's already having a disease. The patient already have the fever and the chills. Maybe malaria, maybe anything. Okay, disease is there. Okay, so it's again secondary. Okay, but patient is going to the malaria clinic for peripheral smear. So it is secondary made diagnosis. Secondary made, not treatment, it's diagnosis. It's diagnosis. Secondary and diagnosis, not treatment. The person is doing the peripheral smear. And the next question, you got it. This is secondary and diagnosis. The next question, again the same patient with fever and chills. But this time patient is taking the treatment. So ये secondary में treatment है. I guess you got it. I guess. The next question in front of you. There is a person inside the bed net. You know bed net, I told you, bed net I literally apply bed net. There are many mosquitoes at my home. So this is the bed. This is the bed over which we are applying the net before sleeping. And we are sleeping here like this. So that mosquito present in the environment, they cannot reach the person. है ना? So what? So risk factor is present. Mosquito is a risk factor, but disease is absent. है ना? Disease is absent. So which level? You all are right. It's primary. But in primary we have two options, na? Is it health promotion or specific protection? I mean, is it non-specific or specific? Applying net can prevent me from anemia. No, it will prevent me only from mosquito-borne disease like malaria, dengue. है ना? So correct answer is specific protection. Yes, very good. Primary में it's not health promotion. Many people are saying health promotion. Primary है, लेकिन health promotion नहीं है. It's specific protection. It will give me only protection against specific disease which are mosquito-borne. Other diseases are not protected. It will not give me protection for polio, for diphtheria. Got it? Say yes, say yes, say something. Okay, you all are right. So correct answer is primary and specific protection. A child coming to immunization clinic for OPV vaccine. So question is regarding vaccine. So child is coming, child don't have polio and child do not want that in future polio bhi ho. So risk factor is present, polio virus is present everywhere, but disease is not there. So I will say it's primary. It's primary. A primary में health promotion है कि specific protection है? So correct answer is primary. Primary में specific. Now you got it. Yes, specific, because OPV will give you protection only for polio, not for others. So primary में specific. So you have to tell me both the things. This is a way you should approach. है ना? So primary में specific, you all are right. है ना? So the next question. A urine strip test for the sugar detection was employed to screen a diabetic patient in the community. In a community, all the people are healthy. They think they are healthy. But we are performing a urine strip test. है ना? To screen the patient. है ना? Screening is done in what? है ना? Maybe in a community, some people... No. Screening is secondary level of prevention. I told you screening is secondary. है ना? So here secondary level of prevention will occur. Okay, ji? Screening is secondary level of prevention. Got it? Screening is secondary level of prevention because maybe some people are diabetic, but they don't know they are diabetic. No, they don't have any symptoms, right? But in the urine, sugar detection test will be positive. So you are doing secondary. Ab secondary में आपके पास दो option है, diagnosis or treatment. What you are doing? You are doing a sugar strip test. So you are diagnosing. So secondary में diagnosis is the answer. If you have any trouble, na, please write down, ma'am, please explain or whatever. Okay, you got it. So this is secondary. Because of the word screening, I am saying it's secondary. And we are doing the diagnosis. It's not treatment. Okay, the next question. There is a village. You are giving a health education to prevent the spread of the malaria. You are going and giving a lecture to the village people. You are accumulating and conducting a camp. In that, you are giving a lecture over. In that village, malaria is very common. So you are telling the village people the ways to prevent the malaria. How you should use the mosquito repellent creams are available, stickers are available. You apply a bed net, and a stagnant water should be removed. Jo bhi ways you know, you are telling them in an easy language. So what basically you are doing? Mosquitoes are present, but malaria don't have they currently. So you are doing primary level of prevention. Is it specific or non-specific? No, it's not primordial. Some people are getting confused. It's primordial mass communication. Primordial may the risk factor will be absent. है ना? Here risk factor is present. You are going for the malaria counseling. So मतलब क्यों जाओगे किसी भी विलेज में मलेरिया की काउंसलिंग के लिए? आप क्यों जाओगे? मतलब वहाँ मलेरिया बहुत होता है, लोग परेशान है मलेरिया से, इसलिए you are going and doing a counseling there कि how to prevent malaria. So mosquitoes are present everywhere. The risk factor is present. Come on, we don't have a world without mosquito. Mosquitoes present everywhere. So risk factor is present. It cannot be primordial. It's primary. The risk factor is mosquito. It's present everywhere. Unless until it is written in the question, there is a mosquito-free village. There is no village without mosquito. There is no space in the world without mosquito. Mosquitoes are everywhere. Okay. So risk factor is present, but disease is absent. I will go with primary, not primordial. Or primary mein what you are doing? You are doing a specific protection. Oh, I'm sorry. Primary mein you are doing health promotion. Although ठीक है, health promotion, you are giving, actually it should be specific protection according to me, because you are giving the guidelines only, the health education only for this prevent spread of malaria. If I remove this word, a village community given health education, then it will be health promotion. Overall, you are giving good health education to the village people, then it will be health promotion. Otherwise, specific is more good according to me. Yes, it is specific. Okay, the next question. Okay, there is a 5-year-old child. Okay, 5-year small kid is there, and you are discouraging the child. Don't adopt harmful habit in your future. Don't smoke in future. What you are doing actually? 5-year child don't smoke, of course. No one smoke at the age of 5, of course. And you are discouraging. I know you don't smoke, but in future also you don't smoke. So what you are doing? The risk factor is absent. And before that, you are counseling and discouraging the person to do smoking. So of course, you are doing primordial level of prevention. Very commonly asked question. Very good. Primordial means individual education. Primordial means 1-to-1. It's individual education. You all are right. So it is individual education. Can I go to the next question? There is a child having the polio and you are providing crutches. Polio is already there. It's already paralytic. So it's already complication. So it's tertiary. It's tertiary level of prevention. Hana? And you are doing rehabilitation. Providing crutches is rehabilitation. In tertiary, we have two options. Disability limitation, like if instead of crutches, they give you physiotherapy. Physiotherapy is disability limitation. Tertiary hai wo, lekin disability. We are having two options, na, tertiary mein. Disability limitation and rehabilitation. So here we are doing rehabilitation. You all are right. Tertiary level mein rehabilitation. Okay. Reducing polio by immunization. ये polio को crutches देना था. We are giving crutches to the polio. So that was tertiary level. है ना? But reducing the occurrence of polio by immunization. What is that? Immunization is always primary level. है ना? So it's primary level में specific protection, I guess. Am I right? Now I will not explain you all. You got it. Yes, it's primary. है ना? So providing crutches to polio is tertiary. But reducing polio by immunization or vaccination, it's primary. Primary maybe it's specific protection. I hope you got it. Right? Arranging a school for blinds. This is blind. Arranging a schooling for blinds. So again, it's rehabilitation in the tertiary. It's tertiary level because person is already blind. So it's tertiary. Tertiary may rehabilitation. Okay. Providing clippers for walking. Why? Clippers means crutches. You are providing crutches for walking. Again, it's tertiary may rehabilitation. I hope you got it. Can we solve some questions now? These were also questions, but now I will give you four options. The questions are in front of you. Everyone be ready to answer it as fast as possible. All of the following represent specific protection of the disease except. Specific protection except chemoprophylaxis for meningococcal meningitis, personal hygiene and environmental sanitation, usage of condoms, iodization of salt. What is the correct answer? I'm waiting for your reply. I'm asking which of the following is not specific protection. The question contains except. Which of the following is not specific? I mean, which of the following is non-specific? Non-specific kaun sa hai inme se? You all are right. Absolutely right. The correct answer is B. By improving the personal hygiene, I mean hand washing, good lifestyle, you can overall improve the disease, not any one disease. But for chemoprophylaxis for meningitis, you will prevent only meningitis. By usage of condom, you can prevent only pregnancy. By usage of iodized salt, you can only prevent goiter. So one disease can be protected. But overall, for personal hygiene and environmental, if your environmental sanitation is there, proper cleaning is there, so overall all the diseases will reduce. Yes. So B is non-specific. Rest all are for one disease. How many of you got it? So correct answer is B. This is how you have to approach. Approach is important. Anna, learning is not important here. You have to understand the approach. The next question. Okay. Secondary level of prevention include all of the following except which of the following is not a secondary level of prevention. What is secondary? The disease is already there. Anna, the disease is already there, but you want to halt it at early stage by giving diagnosis and treatment. So you are doing screening for diabetes. Is it yes or no? You are doing case finding of falciparum. Is it yes or no? You are doing contract tracing for STD, STI, sexually transmitted disease, or you are doing reconstructive surgery in leprosy. Which of the following is not secondary? Which of the following is not secondary? I'm asking. Yes, most of you are right. Be fast. So correct answer is D. Okay. So if the person is diabetic, there is a community, you are screening. Screening is always secondary level of prevention. Anna, here you are for falciparum malaria, you are doing case diagnosis. So here, this is also you are diagnosing, this is also you are diagnosing, and this is also, whenever we find a case of any STD, for example, HIV is one of the STD, sexually transmitted disease. So if you find any case of HIV, now you will ask that person, you will do personal one-to-one counseling. It's very confidential. It is always one-to-one. Okay. So you will ask the person all the sexual partners. You have to take that patient in confidence. After that, you have to trace the sexual history because this person have the HIV with all the person, this person have done the sexual intercourse. They all can also have HIV. You want to trace them. So what actually you are doing? These persons have disease, but they are asymptomatic. The sexual partners are not coming to the treatment. So that's why they are asymptomatic. So at early diagnosis and treatment, you want to give. So contact tracing in sexually transmitted infection is again a type of secondary intervention. Okay, secondary level of prevention, I mean. You are doing the diagnosis. But reconstructive surgery is rehabilitation in leprosy. Okay, yes, it's tertiary. Very good. But rest, it is tertiary, I agree. But remaining three are secondary. That I am proving. Okay, Ji, the next question is in front of you. In an area, please understand question is difficult. Even I get confused sometimes. There is a fluoride-rich water. Hana, fluoride. You know, if there is fluorine is more in the water, it leads to paralysis. It leads to crippling. It leads to a disease which is known as fluorosis. That is crippling fluorosis. Hana. So in an area, fluorine-rich water is there. Hana. So government is doing defluorination before supplying it to the people. So government take that. So we all have water supply from the government. Either we have like supply from the government or we have water from the boring. Hana, bore well, I mean. Okay. So whatever water you are using, you should check the fluoride content. Say yes or no. Hana? So we are doing defluorination before it reaches to the people. So what level of prevention is it? So risk factor is present. Risk factor is already fluorine is high in the water. But before disease occurred to the people, you are removing the extra fluorine. Hana? So before the disease occurs, you are taking the intervention. So you are doing primary level of prevention. How many of you got it? Yes, the answer is primary. Absolutely right. So you have to understand the concept. Okay, the next question. Which of the following is an example of disability limitation in polio? You want to limit the disability in a polio person. The tertiary level of prevention. You are reducing the polio by immunization. You are arranging a school for the blind. You are resting affected limbs in neutral position, or you are providing clippers for walking. I want to hear, no, it is a little bit tricky question. Yes, resting limb in neutral position. I mean, doing physiotherapy. Resting limb in neutral position and doing the physiotherapy. That is disability limitation. Anna, instead of that, if I change the question to rehabilitation, your answer will become D. Your answer will become D in that case. Currently, the answer is C. Got it? The next question. Which of the following is the primordial level of prevention? Can you tell me the answer? The primordial level of prevention. Read the four options. What is the definition of primordial? Action taken prior to the disease, or action taken before the emergence of the risk factor, or action taken to remove the possibility that the disease will ever occur, or action taken that halts the disease in early stage. What is the correct answer? I'm asking. Come on. Which of the following is the definition of primordial? Primordial क्या होता है? Where we take the action. Primordial, we take the action before the risk factor, before the emergence of the risk factor. Risk factor के आने से पहले ही उसका action ले लेते हैं. Like discouraging a child, don't do smoking in future also. Currently you don't smoke, लेकिन in future also you don't smoke. So that is the correct answer is B. How many of you got it? No, Hari Krishna, it's not C, it's B. So primordial is we are not taking action prior that the possibility disease will never occur. No. We are taking prior to the action of the we are taking action prior to the emergence of the risk factor. How many of you got it? If I change the question from primordial to primary, what is your answer now? Primary. Would you like to change? Currently, answer is B. But if I change the question from primordial to primary, I'm asking, what is your answer in that case? What is primary? Yes, Karthik, repair and disability limitation is same. I told you two ways, na? Repair and rehabilitation. Repair and disability limitation is same. Absolutely right. Yes. So primary is action taken prior to the disease. The risk factor already appeared, but disease have not occurred. So prior to the action, action taken prior to the disease will be primary. In that case, my answer is A. Why people are saying C? I don't know. C is nothing. Action taken to remove the possibility that disease ever occur. ऐसा तो मैंने कहीं बोला ही नहीं है. ये तो किसी भी चीज का definition नहीं है. This is a rubbish definition. Got it? The correct answer in that case is A. And if I change the question to secondary level of prevention, what is the definition? What is the correct answer in that case? Action that halts the progression of the disease. The disease already occurred, but you want to halt it at early stage. In that case, your answer becomes D. So if I change the question, the answer changes accordingly. Please understand. Okay. The next question. Immunization is what level of prevention? Now everyone knows what is immunization. Is it primary, secondary, tertiary, or disability limitation? I'm asking. What is the correct answer in that case? Immunization, that is vaccination. In vaccination, the risk factors are always present in the environment, but we don't have disease. I'm vaccinated for polio, diphtheria, tetanus, pertussis, MMR, so I will not have these diseases. But risk factor is present in the environment now, so it's primary level. Vaccination is always primary. Please learn. Vaccination is always primary. Okay, so correct answer here is A. Can we go ahead? Childhood obesity prevention is a type of, we should promote the children. If some children is little bit overweight, now we should ask them to do the more physical activity, to play more outside games, and to reduce their weight. Reduce means they should be normal weight. The children should not be underweight, but should not be overweight. Sometimes we make the children eat too much. Too much eating is not healthy. Adequate eating is healthy. Please understand. Too much eating will lead to obesity. Obesity is a risk factor. Risk factor for hypertension, risk factor for diabetes, risk factor for heart attack, risk factor for MI, ischemic heart disease. Obesity is a risk factor for many diseases. So childhood obesity prevention, what we are doing, the child is not obese, and we do not want to let the child to obese. I'm having a kid. My kid is not obese. But in future also, I do not want the kid to be obese. So before the risk factor appears, I'm preventing it. So that in future, my child don't have the diseases which are obesity related. Okay. So I'm doing primordial prevention. It's not primary. I also get confused in that. So very logical. You can think it's primary. I'm not saying the child is obesity. I'm preventing the obesity. Like childhood smoking. Child don't smoke. Before they smoke, I'm taking the action. Yes, please don't smoke. In future also don't smoke. So child is not obese right now. I'm preventing the obesity. Take the words. It's a little bit English language, which is difficult. I guess you are getting the confusion in the language. The child is not obese right now. I'm not saying the risk factor is present. I'm saying risk factor is absent, and before that, I'm discouraging it. I know obesity is not a good thing, so I will not overfeed my child ever. I will not. I will give my child a balanced nutrition, right? So that my child is good growth, like it not underweight, not overweight, because I know obesity is a risk factor of many diseases. So I will not overfeed. So I'm doing primordial level. Before the risk factor appears, I'm taking the action. Say yes. Say yes. So the correct answer is primordial, not primary. How many of you got it? Every one of you told me primary. None of you told me primordial. You got it. It's same like smoking, discouraging smoking in a child. Child don't smoke. Here, child is also not obese. I have not written a obese child is there. I have not written this word. Okay, Ji, got it. Everyone respond. People respond. Okay. So next question. So I'm leaving the questions. Now you know. Okay. All of the following come under primary prevention except. You tell me which of the following do not come in primary prevention. Not come in primary prevention. Pap smear, helmet. We wear helmet now on two-wheeler. Contraception like condoms and vaccine, which is not an example of primary prevention. We wear helmet before accident occur. Before accident occur. We like people use contraception before pregnancy occur. Before pregnancy occur. Vaccines. We use vaccine before disease occur. We use polio vaccine before polio, diphtheria before. So before disease occur. Okay, but what about the pap smear? Pap smear is diagnosing after the cervix may cancer started. It is a type of screening test. Female don't know she has cancer, but it is already started in the body. So that time we do this pap smear. Pap smear is a type of screening test. All the screening come in secondary, I told you. Say yes. Got it? How many of you got it? So correct answer is A, not B, not C, not D. So if you have the concept now, you can apply. We have done many examples. Okay, Ji. The next, can I come on the next topic? So last half an hour, we are studying the same thing. Are we completed? Everyone got it? The levels of the prevention. Yes, vaccine is primary. Tirupati, still I am saying the vaccine is primary. Where you got confused? Tirupati? Vaccine is primary. Still I am saying vaccine. Pap smear is not vaccine. Vaccines are primary. I told you, it is primary. Contraception is also primary. Helmet is also primary. I guess you are skipping the word except. In the question, except is asked. Okay, Dr. Jacqueline, I cannot go to the last, I cannot go back, but you asked what is the thing in that. So let me tell you, you have trouble in tertiary. Okay, tertiary level of prevention. So primordial, primary, secondary, tertiary. In the tertiary, we are having two modes of intervention. Many students have confusion in that. So one is disability limitation, also known as repair, you can say, and rehabilitation. Okay, so let me give you example of polio in both of them. So if you say there is a polio patient, so polio is already tertiary, the disease is already there, complication is already there. Now, if you are providing crutches or caliper for walking, so you are doing rehabilitation. But if you are doing the physiotherapy in the polio, or you are keeping the limbs in neutral position, as much as possible neutral rakho, usko extensor or flexor mat karo, neutral, neither flexion nor extension. So, the disability will be less. So you are doing disability limitation by physiotherapy and keeping the limbs in neutral position. These are the two examples of disability limitation. This is an example of rehabilitation. Ultimately, all of them are example of tertiary care. How many of you got it? Doxycycline, you got it? I guess this is your query. Can we go ahead? Everyone is done? Okay. The next topic. Okay, finally the next topic. Let me tell you 4 things. Please, everyone concentrate here. Everyone on the screen. Listen, very important and difficult to understand. Disease, impairment, disability, handicap. There is a difference between all 4. Like I told you, the difference between disease, illness, sickness, a minute difference was there. Here also there is minute difference. Let me explain. What is disease? What is impairment? What is disability? What is handicap? Let me explain you all these one by one. Okay. So what is disease? Can you define disease? Any abnormal condition in the body that impairs function. That is a disease. In my body, if any abnormality occur, that is impairing my function. That is my disease, whether I'm aware or not aware. Sometimes it's very minute and I am not aware of that. And that is my disease. Okay. Impairment. Impairment, because of the disease, there is loss or abnormality of physical, psychological, and anatomical structure. Because of the disease, there is loss of one of the things. Either I am having deficient psychological function, either I am having deficient physiological function, or some loss of anatomical function because of the disease. So I will say I am having impairment. I'm having impairment. Because of the impairment, I cannot perform the activity which I routinely perform. I cannot perform that activity. Because of the impairment, I routinely perform some activities. I'm teaching, I'm doing something, right? But because of the impairment, I'm not performing the thing which I'm supposed to perform or which my peer groups are healthily performing. So that is, I'm disabled. And because of which I'm getting a disadvantage in the society. I'm getting a disadvantage because of not fulfillment of my role in the society, which is considered normal for me. I'm handicapped. Let me explain with the help of example. All the 4 terms are very closely related. Sheikh, I will come on your query. Let me finish this. I'm in the middle of something. Okay, I will come. Wait a while. Okay. Now, disease, impairment, disability, handicap. Disease, impairment, disability, handicap. Listen, for example, someone have an accident. Some person have an accident. So accident is something abnormal happen. I will compare the accident as a disease. In the accident, for example, as unfortunately the person lost the foot. So it is anatomical, some anatomical structure is lost. Or some physiological structure is lost. Physiological dysfunction is there. Psychological, it is not always anatomical. It can be physiological, it can be psychological, or it can be anatomical. Anything which is deficient or lost. So I will say it is impairment. No, because of which person is not able to walk. Normally that person can walk, but now after the loss of the foot, person cannot walk. So this is a disability. Now person was doing a job in an office. He is fired from the job. Because he cannot walk now. So he cannot perform his responsibility, the social role. So he is unemployed now. So unemployment is a handicap. Got my point? Okay, now please listen 2 questions very carefully. Please listen 2 questions. A person cannot walk, but employed. Cannot walk properly, but employed. What is the answer? And person cannot walk and unemployed. What is the answer? I'm asking. What's the correct answer? I will say this is disabled. But employed. I will say this one is handicapped. This one is handicap. What is handicap? Handicap is inability to perform the social role because of disability. How many of you got it? How many of you? These both are PYQs. Students always ask me, ma'am, both the time, 2 times exam में ये question आया, दोनों बार answer अलग है. Yes, answer अलग है because question अलग है. They changed one word, no? They changed one word. The person is employed. Now, person cannot walk with the help of calipers. Somehow he is doing his work, managing. So I will say the person is disabled, but I cannot say the person is handicapped because he's earning, he's doing with the help of calipers, with struggling, he's doing. But if I say the person cannot walk and he's employed, unemployed and sitting at the home only, so the person is handicapped. So disability leads to handicap. Got my point? Handicap don't leads to disability. Disability leads to handicap. How many of you got it? How many of you got it? Read your question very carefully in the exam. Got my point? So can you define the 4 things for me, please? What is disease? Say any abnormal condition in body. Say any abnormal condition in the body is known as disease. What is impairment? Because of the disease, any loss of anatomical, physiological or psychological function. Physiological, psychological or anatomical function. जैसे कि यहाँ पे loss of foot is anatomical loss. It can be psychological loss, it can be physiological loss. That is impairment. Because of which person cannot perform the activity which is considered normal for that person. The inactivation, I mean, cannot perform the activity which is considered normal for that person, that is disability. But because of that, the person cannot perform the role in the society which is supposed to be normal for that person. So that is known as handicap. Hana, this is any abnormality. See, I have written the 4 definition in short. How sweetly, shortly I have written the 4 definition. Please understand the 4 definition very well. Disease is any abnormal condition. Impairment is loss of anatomical, physiological, or psychological function in the body. Disability is inability to perform an activity which is considered normal for that person. Like person cannot walk, and it was considered normal walking for every one of us. And because of which the person cannot perform the role in the society which is supposed to be normal for that person. So unemployment is handicap. Everyone got it? I guess everyone got it. So the same thing is written in front of you. Accident, loss of foot, cannot walk, unemployment. This is a disease because it impairs a function. Loss of foot, loss of anatomical structure, so it's impairment. Cannot walk, walking is considered normal routinely for all of us. We all can walk. But someone cannot walk, which is abnormal. So it is disabled. But because of which, loss of the job, he is fired from his job because the person cannot, and someone else is employed in his place. So he cannot perform his role in the society. That is earning for his family. He cannot do so. So he is handicapped. So it is not necessary that all disabled are handicapped. It is not necessary. The person can be disabled, but being handicapped or not handicapped, it depends on the social role, whether the person after becoming disabled doing a job or not doing a job. That is my point. Now read the question. The sequence is very clear. Disease lead to impairment, leads to disability, leads to handicap. DIDH. You can say disease, impairment, disability, handicap. Now tell me, the first question is in front of you. I'm waiting for your answer. Fast, very fast. I'm waiting for your answer. Yes. What is the correct logical sequence? Tell me the correct answer. 4 options are in front of you. Everyone is right. Everyone is right. Very good. Very good. Everyone. You all are superb. The correct answer here is B, DIDH. Disease lead to impairment, lead to disability, leads to handicap. I told you the sequence. Please read the question very carefully. There is a person who has lost his foot in an accident and now cannot walk. That's it. Person lost his foot and now because of loss of his foot, the person cannot walk. What you will say? Is the person diseased, disabled, impaired, impairment, or handicapped? Please think before you answer. And if you are wrong now, I'm going to slap you. Please think before you answer. Don't jump on the answer. That is, I mean, I have not said the person is unemployed. Don't say handicap. Handicap is not the answer. I have said that person cannot walk. I have not said that person is unemployed because of that. If I have not said, don't assume by yourself that कि walk नहीं कर पा रहा तो unemployed होगा. मैंने कुछ comment नहीं किया. I have not said anything ना. So be restrict to your answer. Whatever information given to you, restrict to that only. And don't assume by yourself. ठीक है? Maybe the person is working in a job, like doing some job with the help of caliper, crutches. He's somehow managing. On the wheelchair, he's managing. Many people who are disabled, but they are not handicapped. On the wheelchair, they manage. Somehow they manage. So yes, the correct answer, yes, very good, Tanu. The correct answer is disabled. In the same question, if I add one more thing, he cannot walk and unemployed also, your answer will become D in that case. But currently answer is B. I hope you all got it. Can we go to the next topic? The next topic is monitoring and surveillance. I guess this is the last topic, or after that ICD is there. So last 1-2 topics are there in this chapter, and then we will quickly move on the next chapter. Okay. Why answer is not impairment? Very good, Ammu. Very good question. So Ammu, because I have said the person is not able to walk. If I say only Ammu, the person has lost the foot, then the answer is impairment. What is impairment? Impairment is loss of anatomical function. So loss of anatomical function तो है ही है, but because of which person cannot able to walk भी है ना साथ में. So if I say only this much of question, loss of foot, your answer is impairment. But Ammu, I am saying because of loss of foot, person cannot walk also. I'm adding some additional information. So impairment already converted to disability in this case. It is already converted to disability. But if I have not said unemployed, if I add unemployed also, you will say, ma'am, disability already converted to handicap now. It is stages. At one time, only one can happen. It is not multiple thing. Impairment only lead to disability, but in this case, it has already happened. I cannot go back now. Okay, this is the thing. So can we go ahead now? Okay, yes. Sheikh, I agree. Sasika, I agree. They not even mentioned employed. So why you are assuming whether the person is employed or not employed? Forget it. No, Sasika, forget it. Whatever information given to you, based on that, you give your answer. Huh? The last point, whether the person is employed or not employed, I'm not taking that in consideration. Usko chodo na. Let it be. It is not given, so don't consider neither positive nor negative. Whatever information given to you, based on that, what is the correct answer? If person is employed or not employed, I cannot know. I don't know for this question. I cannot comment on handicap. So I will not say handicap is my answer. Got it, Sasika? This is the excuse I can give it to you. Can we go ahead? Anna, questions are tricky, but not very difficult. You can try. Okay. So going to the next question. Okay. Next topic, I mean. What is monitoring? What is surveillance? Let me tell you. Monitoring and surveillance both is vigilance of an activity. Monitoring one time, we do the vigilance one time, है and here it's a continuous. Surveillance is the continuous cycle. It's the continuous. Okay, I will take this monitoring and surveillance in that chapter. Like it will come again in the detail when I will teach you the chapter of the healthcare services, healthcare in the community. So leave it here. Here it's in short now, so you will get confused. Leave it here. Okay, the last topic, the International Classification of the Diseases, ICD, International Classification of Diseases, ICD, the 10th edition. What is ICD? It's a book. It's a book. It is international. It is not national only for India or only for some country. It is international. Hana, currently we are having 11th edition. Hana, this is the last edition, 10th edition. So 10 and 11 are representing the edition of that. Hana, ICD-10 is the abbreviation of International Statistical Classification of the Disease and Health Related Problems, the 10th revision. Hana, it is giving uniform classification of all the mortality and morbidity in the world. Okay, it is an international standard diagnostic classification of all the diseases present in the world. Hannah, it revised every 10 years. Every 10 years. Hannah. So ICD came in 1993 and it was having 22 chapters in that. This is the old one. And now in 2018, we have the 11th edition. It is having 3 volumes and total 26 chapters. Just learn, there are 3 volumes, total 26 chapters. It is given by the WHO and it is in 2018. It is the 11th edition we are having. Volume 1 have only tabular list. Volume 2 have the reference guide. And volume 3 have alphabetic index. From A to Z, all the diseases are there. Whatever diseases available in the world, not in India, all alphabetical. So these are the 3 volumes. You can see the 26 chapters. Don't learn. I don't want you to learn the chapters, chapter 1, 2, 3, 4, 5, 6, 7, 8, 9, like all the chapters we are having. Okay, so just for your knowledge, you should know that. Okay, what is true for ICD-10? Revised every 5 years, consists of 10 chapters, arranged in 3 volumes. It was produced by UNICEF. What is the correct answer? It was not produced by UNICEF. It is produced by WHO. Consists of 10 chapters. It is having 20 chapters and now 26 chapters. Revised every 10 years, 5 years, 10 years. So correct only one, arranged in 3 volumes. That's it. We are done. We are done. Okay. Okay. You should know both the additions, Namrata. Just the important points of that. I'm not asking you to read the complete ICD-10 and 11. You should know the full form. By 10 and 11, what it is representing? It is representing the addition. Anna, you should know the full form. And who has done that? The WHO has produced it, not the UNICEF. The basic, and how many volumes it have, how many chapters it have, the basic information. In how many years it is revised. Okay. Okay. Can we go ahead? Let me save the annotated version because in the evening you are going to ask me. And let me open chapter number 2. So please open. You already have the notes with you, I guess. If you want to open, it's your choice. I'm starting nutrition now. So today I want to teach you 4 chapters. 1 is done. Okay. Okay. Just a second. Let me open the nutrition. Can you see my screen? I'm asking. Can you people see my screen? Can you see I have opened nutrition? Lunch break will be 2:30 onwards. Aditya, you are hungry? Lunch break will be late. Okay, can we go ahead? The nutrition, the next chapter. Quickly, you can see the slide. Kindly someone confirm you can see the slide. So let's start nutrition. Then chapter number 2. Quick, fast. Okay, I will be a little bit fast. So nutrition, in our diet, whatever we eat, we get 3 things: carbohydrates, fats, and proteins. The three major macronutrients in the diet. Hana, we get carbs, we get fats, we get protein. So we have to see the detail of all of them. Carbs, fats, and protein one by one. Okay, so let's start it. The nutrients in the diet. Okay, these are the macronutrients, and in the micronutrients we have many minerals in our diet. We eat sodium chloride, salt. It contains sodium, potassium, magnesium, calcium, phosphorus. There are some trace elements like iron, iodine, fluorine, zinc, and there are trace contaminants. Okay, so these all are micronutrients, and these three are macronutrients: the carbs, the fats, the proteins. Okay, now let me tell you, if you are eating 1 gram of carb, any carb, so it will give you 4 kilocalorie after going and burning in the body. After combustion, it will give you 4 kilocalorie. If you are eating anything protein, 1 gram of protein produce again 4 kilocalorie in the body. And 1 gram of fat produce 9 kilocalorie of the energy. Kilocalorie is the unit of energy. I guess everyone knows the basics. Kilocalorie is energy. They all provide us energy, no? Why we eat? Of course, we want energy. That's why we eat. Energy is measured in kilocalorie. So we eat carbs, fats, and proteins to get energy. 1 gram of carb give 4 kilocalorie, 1 gram of protein give 4 kilocalorie, 1 gram of fat give 9 kilocalorie. Say yes, you have to learn these figures. So please learn the figures. Okay, 449 kilocalorie. 1 gram of carbs, 1 gram of protein, 1 gram of fat, to be crystal clear without any confusion. What is a balanced diet? The next thing. What is a balanced diet? Let everything keep on interacting. You got it. Okay. So this is the energy requirement. I told you 1 gram of carbs, fats, and protein produce how much of energy. The next is the balanced diet. Coming on the balanced diet. What is the balanced diet? Ideally, a diet out of the 100% energy you require. Just suppose I'm eating. I'm eating a little bit of rice, little bit of sabji, little bit of pulses, dal. I'm eating a roti, chapati, salad. Multiple things I'm eating. So whatever I require, I will tell you the requirement also. Daily, how much we require, how much kilocalorie we require. So whatever energy we require, out of that 10 to 15% should be provided by protein. So I should include the protein in my thali, in my diet, 10 to 15% only. Out of the total. 15 to 30% should be provided by fats. By fats, I mean ghee, butter, oil. These are the fats. And 50 to 70% of the energy should be provided by carbs. This is known as balanced diet. So ideal plate, this is known as healthy plate model. It is given by ICMR and NIN. What is NIN? It is the National Institute of Nutrition in Hyderabad, NIN Hyderabad. So the NIN has given the following plate model. It can come in the form of image-based question. The image can come in your exam and they can ask you, what does the image represent? This represents healthy plate model. What does it represent? Healthy plate model. The logo is my plate for the day. This is the logo given to this. My plate for the day. It contains whatever, it contains multiple things. You should not eat one thing. You should eat multiple things in the diet. A little bit of everything. So it contains 10 to 15% of protein, number one, 15 to 30% of the fat, and 50 to 70% of the carbs. Say yes, say no. This is known as healthy plate model, balanced diet. Balanced diet. How many of you got it? Learn the logo. What is the logo here? My plate for the day. What is the logo? My plate for the day. Got it? Can we go ahead? Say yes. Okay, don't learn in kilojoules, Elizabeth. In physics, you may have learned how to convert kilocalorie in kilojoules. Anyways, kilocalories is more important. But anyways, you can do the conversions also, I guess. Okay. So let's go ahead. Read the question, tell me the answer. The optimum calorie which should be provided by protein in a healthy plate model in balanced diet. How much energy should be provided by protein? It should be 10 to 15, 15 to 20, or 20 to 30. I'm asking. What is the correct answer? It should be 10 to 15. Very good. It should be 10 to 15. Okay, so 10 to 15 is the correct answer. So can I go ahead? So till now we have learned in our diet, there are 3 macronutrients. What are the macronutrients in the diet? We all have carbs, we have protein, and we have fats. How much energy they provide? 1 gram of carb give 4 kilocalorie. 1 gram of protein again give 4 kilocalorie. 1 gram of fat give 9 kilocalorie. Must learn that. I hope you got it. Now in a balanced diet, either say balanced diet or say healthy plate model. One and the same thing. Healthy plate model. How much percentage should be provided by each of the macronutrient? 10 to 15% should be by protein. 15 to 30% should be by fat, and 50 to 70% should be by carbs. Till now, I taught you this. I guess everyone got it. Everyone got it. Yes, absolutely right. Absolutely. You can learn 449, but learn what is 9. Okay, 9 is fat. Okay, let me come on the next thing. The next thing is reference Indian man, reference Indian woman. I'm talking about Indian man and woman. You can see she's a reference Indian female, and this is a reference Indian male. Okay, so tell me the criteria. Tell me the criteria. 5 criteria for each of them. The 5th one is common. 4 are different. है ना? According to their age, according to their weight, according to their height, and according to their BMI. BMI is basal metabolic index. Age is common, है ना? Say, just a second. Just say 19 to 40. I say 20 to 40, I mean. 20 to 40. 90 to 39 give me a trouble to learn. I can learn 20 to 40 better. So 1 minus, है ना? 19 to 39 याद करोगे भूल जाओगे. है ना? Learn 20 to 40. नहीं भूलोगे. है ना? 20 to 40. You can understand 20 to 40 is 1 minus, it's 90 to 39. It's like price tag. Instead of 1000, they write 999 in the same way. And it gives me trouble. So just learn 20 to 40. Straightforward. Okay, this is the age group you can learn. Actually, it's 19 to 39, to be frank. Okay, weight-wise, the man should be 65 kg, the female should be 55. The weight is different. Age is same, but the weight is different. Height is different. We know in India, the boys are a little bit taller. The boys are a little bit taller as compared to the females. Little bit. Hai so height, you can see the height of man is 1.77 meters, not centimeter, of course. Hai and it's not foot also, it's meter. And the female is 1.62 meters. You have to learn the figures. Nutrition mein bahut sare figures you have to learn. Hai keep all the figures in the mind. At least you can pick up in the options. Okay, and BMI, again, BMI. The females have more BMI because females have physiologically more fat as compared to males. है ना? So male का BMI 20.75 and female का 20.95. Please learn 20.75, 20.95. Okay, so please learn how to learn. And after that, the 5th and the last criteria, both male and female should be free from any disease and they are fit for the work. है ना? They should work for 8 hours, they should sleep for 8 hours. है ना? Anyone who's working for 8 hours and fit for work, free for disease, sleeping for 8 hours, 4 to 6 hours of sitting and moving around, 2 hours of recreation. That is a healthy reference Indian men and women. Can we revise it? Can you help me in the revision, please? Tell me reference Indian male and reference Indian female. Please tell me. Tell me based on the 5 criteria. Let me ask the criteria wise directly. So first criteria, tell me according to the age. Tell me according to the weight. Tell me according to the height. Tell me according to the BMI and others. Can we revise it? Tell me the age of male and female. Age. Age is same. 19 to 39. 19 to 39 years. Here also, 20 to 40 you can say if you wish. Okay, 19 to 39. What about the weight? Weight is different now. For male, it's 65 kg. The reference Indian male is 65 kg. Reference Indian female is 55 kg. This is reference. This is the reference Indian male and female, 65 and 55 kg. Height. Height is 1 point. We know boys are taller and the girls are a little bit shorter. So 77 and 62. I learned like that. Meters. 1.77, 1.62 meters. Am I right? Yes, you have to learn like that. Okay, please learn. You all are right. Learning height and BMI is difficult. Rest things are easy. So BMI is 20 point, both of them. But I told you females have high BMI because of more fat. So it's 9.95. Here it's 7.5. 7.5 in the males and 9.5. You got my point? So can I say, listen everyone, the age is equal. Weight wise, boys are more. Height wise, boys are more. But BMI wise, girls are more. You can learn like that also. Okay. One more thing, others they are free of diseases and fit for work. 8 hours of work, 8 hours of sleeping, 2 hours of recreation. Okay. And 4 to 6 hours of moving around. That's it. We are done. This is common for both. Okay, the common for both. So this is the definition of reference Indian male and female. Please fit in your mind. The ones you say, the ones you write, these figures, it will become clear to you. I hope everyone learned the values. These are the old guidelines. I'm telling you the new guidelines. These are the new NIN guidelines given. Learn the newer one. Don't learn the older one. In the older one, the age was 18 to 29. Don't learn. Age was also different for male and female. But now it is same. Don't see, just I'm showing you. Initially, the male was 60 and female was 55. Now the male 60 ka 65 kar diya, to female to 55 hai. These are the old guidelines. Don't learn that. Don't learn. I'm saying you to learn the newer one. The question will be according to the newer one. Okay, see the question, tell me the answer. Which of the following is false regarding reference Indian woman? Tell me which is false regarding reference Indian woman. Age, is it true or false? Weight, is it true or false? Height, is it true or false? BMI, is it true or false? Tell me which is false. Huh? Age, weight, height, and BMI. Regarding the female, the woman. Yes, yes, you all are right. Aditi, Leah, huh? Shri Niket, everyone is right. Please answer. Yes, yes. Here also, everyone is right. Both the places, you all people are right. Very good. The correct answer, it's not 50 kg, it's 55 kg. Rest of the things are good. Okay, the age is correct, height is correct, and BMI is correct. But yes, absolutely right, Elizabeth, it should be 55 kg. So correct among them is 50 because they are asking the false statement. This is false. Okay, so next is calorie requirement. How much calorie you require? Tell me your own calorie requirement in one day. In one day, how much you should eat so that you should get that much of calorie? Huh? What is your calorie requirement? It depends what type of worker you are. You are a sedentary worker, moderate worker, or intense worker. The image itself depicts the meaning of that. Huh? If you ask me, I'm a sedentary worker. Anna, the person who is complete day sitting, not doing any physical activity. My job is sitting on a chair for hours and teaching. So I'm a little bit sedentary side, or you can say a little bit moderate. I do a little bit of physical activity in the morning, a jogging, a little bit. Anna, moderate. Intense worker are they do very hard work. So depending, first decide your category. Then I will tell you your daily calorie requirement. So sedentary, moderate, intense. There are three type of workers. There are three type of person, you can say: sedentary person, moderate person, heavy person. Now this is the first criteria. The second, the gender. Are you a male or female? Depending on that, your calorie requirement may differ. Let's come on the males first. Again, I'm telling you the new guidelines. Then 2020 में ये change हुई है. Before 2020, the old guidelines are there. In many books, still old are given. Don't follow that. Follow the latest 26th edition of the PARC. Anna, please follow that. The latest guidelines you have to follow everywhere. Please follow. Okay, so whatever I'm giving in the notes now, it is already updated. Okay, so NIN 2020 guidelines I'm teaching you, it's 2100 for the sedentary male. Don't learn the next two digits. Learn 2100 is more than sufficient. 2700 and 34. 21, 27, 34. 2100, 2700, 3400. If it is a male, these all three things are male. Say yes. If there is a sedentary male, answer is 2100. Moderate male, answer is 2700. Intense working male, answer is 3400. Learn 2100, 2700, 3400 like that. For females, it's easy. It's easy. Learn only 1600 and it's like this. Anna. So a moderate female is like sedentary male, it's 2100, and a intense female is like moderate male, it's 2700. How many of you got it? So you have to learn only one figure, 1600. 1600, and this will go here, and this is how I learn. Hannah, I don't get confused. This will go here. This is for female. So can I say a sedentary male and a moderate female are equal? Yes. And a moderate male and an intense female are equal? Yes, I can say that. How many of you got it? So learn both of them. Learn. Now female, there are three type of females. Number one, these are the non-pregnant females I talked about. Non-pregnant. What about pregnant female? What about lactating female? In pregnancy, whatever is the category of the female, additional 350. So add 350 in 1600, add 350 in 2100, add 350 in 2700. Don't add now. Add on the spot in the exam, because if you add now and you will learn the figures, it will be difficult for you. Learn overall, add 350. 350 ऐड करना है ना? अब वो sedentary female है, she got pregnant. Now pregnant तो कोई भी female हो सकती है ना? Any female can get pregnant, है ना? These all three category female can get pregnant. If a sedentary female get pregnant, additional 350. If a moderate female get pregnant, additional 350 apart from 2100. And an intense female get pregnant, additional 350 apart from 2700. How many of you got it? Additional 350. And it doesn't depend on the trimester of pregnancy, whether first trimester, second trimester, third trimester, it's additional 350. Again, you get a question, what is the first trimester requirement, second trimester, so you get confused. In all the trimester, it's 350. Say yes, respond, people respond. Now, after pregnancy, what the lady do? The lady lactate the baby, I mean breastfeed the baby. Breastfeeding is exclusive for the first 6 months. For the first 6 months, the lady is exclusively giving breastfeeding to the baby. So she require additional 600. है ना? इसमें 600 ऐड करो इन्हीं तीनों में. more than the pregnancy. In the pregnancy, she was requiring only additional 350. But during lactation, she required more, additional 600, because whatever she is eating, from that, she is creating the breast milk also, and she is providing nutrition to her baby. So she should eat double, not double. She should eat of her own, like 1600, 2100, or 2700 is of own hissa, uska own portion. And for the baby, she should eat additional 600 so that she can synthesize the milk and she can provide it to her baby. So additional 600 during the first 6 months. But after 6 months, the baby start weaning. The baby start other food also. So breast milk gradually reduce. And mother pe zyada burden nahi hai. The baby start eating pulses, dal, roti, chapati, all. Hai. So breast milk gradually reduce. So after that, 520 also work. Additional 520. How many of you got it? We will try. You will try. You will help me. Of course, you have to. Hai. So tell me male. There is no further category of male. Hai. But females are of 3 types. Say non-pregnant female, okay ji. Say pregnant female, okay ji. And the third one is lactating female, okay. Anna, the 3 categories of the female. Now, in each of them, you have to tell me: is it sedentary person, sedentary person? Okay, is it moderate working person, or is it heavy or intense working person? In each of the category, anything is possible. Who will tell me the answers? Who will tell me the answers? I told you the way to learn. I cannot help you. I mean, you have to learn. There is no escape, but I'm trying to make it easy. I know how I learn. I told you. I start from here 2100. Okay, 2700 and 3400. I don't learn the last 2 digits. I learn only first 2. Because if I try mugging up all 4, it will become difficult for me. Yes, very good. Very good, Prabhingal. Very good. Absolutely right. Hana? In the female, how I learn 1600. That's it. And this will come here. I know that. It's like this, and this will come here. I know that. So I know that a sedentary male is a moderate female. A moderate male is an intense female. Very good. You people are super. Anna? Very good, very good. Anna? So in pregnancy, whatever is the category of the female, in all 3 trimester, additional how much? 350. Don't try to learn now. If you learn ki ma'am 1600 plus 350, it will be 1950. So if you try to write down, you will forget. Let it be now. You know how to do the calculations. Learn additional 350 on the spot. In the exam, you can do the addition and make the final answer. Okay, okay. During lactation, 2 things are there. There are 2 things. 0 to 6 month, what is the answer? And more than 6 months, what is the answer? 0 to 6 month, it additional 600, not 600. ये तो लगेगा ही लगेगा. इतना तो लगेगा ही लगेगा. Additional, you have to add 600. So 1600 plus 600, 2100 plus 600, 2700 plus 600. It's additional 600. By the word additional, I mean that. Yes. And after 6 months, it's additional 520. Additional only 520. Because weaning is started. So 600 ki jagah. So lady should, the lady, the breastfeeding lady, the mother who's breastfeeding her baby, she should eat her own portion, her own requirement, but additionally she should eat extra for the baby also. So that she should synthesize the milk for her baby and feed her baby. Hai. So please learn. And you can see 600 and 520 both are more than 350. So pregnancy में इतना खाने की जरूरत नहीं है. Breastfeeding के time ज़्यादा खाना है. So ladies should eat more while breastfeeding, not during much like pregnancy. In pregnancy, only additional 350 are required. Even in 3rd trimester also. Got it. Got it. Can we go ahead? Learn the figures. Try to learn. I try to make it easy. You get many questions on pregnancy and lactation. Believe me. So I will show you the questions also. Okay. This is regarding the calorie requirement, the new guidelines, the NIN guidelines 2020. I told you calorie requirement. What about protein requirement? How much of protein is required in male, in non-pregnant female, in pregnant female, in lactating female? Again, the 3 type of the female and the male. Protein requirement, not calorie. Protein requirement doesn't depend on the type of worker. It depends only on gender, male or female. Male, non-pregnant female, pregnant female, lactating female. It depends only on male or female. Doesn't depend on the type of worker. So whether I'm a sedentary person, I'm a moderate person, or I'm a heavy intense person, working person, I'm a female, I require 46 gram of protein. That's it per day. Whatever is my weight, I require. All the females require, non-pregnant females require 46. And all the males require 54. 46 grams per day. It's in grams per day. एक दिन में इतना protein खाना है ना? Don't take too much. Don't take less. The adequate protein is like that only. Okay. Initially, it was said to be 1 gram per kg. But now the guidelines are fixed. It's not 1 gram per kg. Okay, it's 54 for male and 46 for female. During pregnancy, it differs trimester wise. In contrast to calories, which doesn't depend on the trimester. In all the pregnancy, first, second, third, it was additional 350 kilocalorie, if you remember. Here in first trimester, no additional protein is required. Mainly the organogenesis, inside the uterus of the lady, the fetus is forming. This is the fetus. Now the fetus organs are formed in the second and the third trimester, mainly in third trimester. So maximum protein she requires in second and third trimester, not in first trimester. So in second trimester, additional 9.5. If you wish, you can do 46 plus 9.5. The answer will be 55.5. Don't learn 55.5. It will be easy to learn 9.5. Now it's your choice. If you want to learn additional 9.5, it's your choice. If you want to learn 55.5 already added, it's your choice. Anna, okay. And in third trimester, additional 22. Anna, so 46, 56, 66, 68. It will be 68. Now it's your choice to learn additional 22 or additional 22 additional. You see, Anna, because organogenesis is taking place. The fetus organs are formed. She required maximum protein. Additional 22. Apart from 46, additional, see the plus sign, it's additional 22. What about the lactation? During the first 6 months, she required additional 17. So do additional 17, 46 plus 17. 56, 63, it will be 63. Hana? And here additional 13. Hana? It will be 59. So these figures, if you try to mug it up now, you will forget. Rather, learn how much additional. It will be easy for you to understand. How many of you are with me? People, respond. Can we write the protein requirement? Calorie and protein requirement, both of them. Can we write? Huh? Will you help me? Will you help me in that? Say. Now, during the first 6 months of lactation, why 17? Because the baby is on exclusive breastfeed. And later on, the weaning is there, so 13 is sufficient. So 17 or 13, hai na? 17 or 13. And here, 9.5 and 22. So can we make the final master table for calorie and protein both? Both, hai na? Let's start it. Finally, we are revising the energy requirement and protein requirement. So let's start it. Let's start with male. Let's start with non-pregnant female. Let's start with pregnant female. And let's start with lactating female. That also I divide in two categories. 0 to 6 months of lactation, more than 6 months of lactation. Let's divide them also into two categories. Easy, easy going, easy. Let's first talk about energy requirement of each of them. Energy requirement. So energy requirement depends on the type of the worker. Is it sedentary worker, moderate worker, or heavy worker? Okay, can we write down once? For the male, I always start with 2100. आगे सब याद आ जाएगा. 21 से याद आएगा 27, 27 से याद आएगा 3400. And female, I always start 1600. And this, you know how we do. It's 2100, it's 2700. Additional in all trimester of pregnancy, it's always additional 350. Hannah, here first 6 months of lactation, it's additional 600 and later on additional 520. Hannah, let's come on the protein. The protein requirement doesn't depend. The protein requirement doesn't depend on sedentary, moderate, heavy worker. It's for male always 54 and for female it's always 46. Am I right? Am I right till now? Till now, am I right? Huh? But for pregnancy, it differs trimester wise. It differs trimester wise. Huh? So we have to write in first trimester, in second trimester, in third trimester. Here it was for all trimester. For all trimester you can write. Huh? You don't confuse. So here in first trimester, additional 0. It's 46 ka 46. Huh? In second trimester, additional 9.5. And in third trimester, additional 22 grams per day. Additional 22. During lactation, first 6 months, additional 17. And next 6 months, additional 13. Am I right? If you wish, you can draw it. And now you get many questions on that. I tried my best. Give me a thumbs up otherwise if you got it. So this is the calorie and the protein requirement we have completed. Energy requirement, protein requirement. In male, in non-pregnant female, pregnant female, lactating female, the first 6 months, next 6 months. In the pregnancy, for which trimester, it's like what? Everyone give me a thumbs up. Respond, people. Got it? Everyone got it? Anyone having any confusion? Can we go ahead? Can we go ahead? Anna, let's solve some questions there. Okay, the same thing is written. Read the question, tell me the answer. Quick, fast. Quick, quick, quick. Extra calories required by lactating mother during the first 6 months. over and above the daily requirement, how much extra are required? Extra calorie, lactating mother, first 6 months, 550, 400, 300, or 600. What is the correct answer? I'm waiting. Yes, absolutely right. Ratnadeep, everyone. Gropada, everyone. Yes, very good, very good. Karthik, very good. So what is the correct answer? Everyone respond, yeah. On the app, there is little bit delay. Yes, the correct answer here is D, additional 600. So instead of first 6 months, if I change the question to more than 6 months, the later, after 6 months, what is the correct answer now in that case? In that case, would you like to change your answer? Instead of 600, what is your answer in that case? Many people are attending live, but they are not responding. I don't know. In that case, answer is 520. It's not there. Go with 550. Yeah, ideally it should be 520. I agree. I agree. Yes, you go with 550. It is closer. At least it is closer. Right? So that is the thing. So instead of lactating mother, if I say pregnant lady, in that case, answer is 350, which is not there in the option. Okay. So the next question, it's there. The daily extra calorie requirement in the first trimester of pregnancy. I'm asking first trimester. What is their answer? Is it 50, 150, 350, or 450? Let's see who is first to answer. Who's first? Who is correct? Let's see. Yes, so correct answer is C, it's 350. If I change it, yes, it's 350. I'm sorry, the correct answer. If I change the first trimester to second trimester, would you like to change your answer? Would you like to change your answer now? What is your answer? Yes, Harsh, don't get confused. Anyone? Yes, absolutely right. It's same in all trimester. So still my answer is 350. If I change it to third also, still my answer is 350. Don't get confused in the exam by the trimester. It's always 350. Okay, you all are right. Very good. Okay, so can we go ahead? Protein pe bhi we will get the question. I will show you question set. Can we go ahead? The next thing, dietary reference intake, DRI. What is dietary reference intake? So I tell you ki this much of calorie you take daily, this much of protein you take daily, this much of iron, this much of calcium, this much of. Who has given the reference range? Reference range कौन देता है? कोई committee है? There is some committee who make the reference range for all the dietary products. Who give the reference range? और हम किसे सही माने? What is the actual reference range? If I say you daily, you are a sedentary female, you should eat 1600 kilocalories. So who has given this range? Why I should trust that person? Why? So what do you mean by reference intake? Who has given? So there are two different terms we use here. You have to understand. Estimated average requirement, EAR, and recommended daily allowance, DRI. DRA, है ना? Recommended daily allowance, EAR and DRA. So EAR, what do you mean by EAR? Estimated average requirement is the requirement of 50% of the population. 50% of the healthy individual require that. So that is estimated average requirement, है ना? And recommended daily allowance, 98% of the population. That is 2 standard deviation. Plus minus 2 standard deviation. I will explain you what is 2 standard deviation when I will teach you the Gaussian curve. There I will teach you what is Gaussian curve and what is 2 plus minus 2 standard deviation. I will explain you. So 98% of the population require what? That is RDA. You got my point? So RDA is more better than EAR. In the EAR, if you add 2 standard deviation, you will get RDA. Got it? So please learn the 2 terms. That's it. Coming on the next topic, dietary fibers. We have seen the carbs, we have seen the proteins. Now let's talk about the fibers. What are fibers? Shall we eat fibers in our diet? Fibers don't have any energy. No, they don't provide any energy. They have zero nutritional value. They don't provide any energy. Okay, still we should include fibers in our diet. है ना? Indian diet contains 50 to 100 grams per day. Usually we should eat 40 grams of fiber daily. Diabetic person should eat more, 48 grams. And Indian diet have it. Usual Indian diet, whatever we eat in our thali, na, the standard veg thali, that have so many of fibers. Cereals and pulses are good source of fibers. Fibers don't have any nutritional value. Still, we should eat it because what does they do? This swells in presence of water. So this is the colon. In the colon, the fibers go, whatever fibers we take in the diet, that go in the colon. Now, in presence of water, they just swell. They just swell. So though they act bulk in the stool and they reduces the chances of the constipation. You know, they swell in water. So in colon, there is water. So in presence of water, they just swell. Because of the swelling, they add bulk to the stool and they reduces the chances of constipation. Okay, so they reduces the tendency to constipation. They add bulk to the stool, है ना? They reduce the transit time. Okay, Hannah, they reduce the incidence of the colon polyp. They reduce the incidence of the colon cancer. They reduce the incidence of the stomach, breast, and prostate cancer. They reduce ischemic heart disease also. Hannah, and they do a better control of the glucose. And that's why they are very useful in a diabetic person. And they reduce the chances of irritable bowel syndrome and diverticulitis. So that is regarding the fiber. Protein requirement we have already seen. I'm not discussing it again. So we have already seen the protein requirement. It doesn't depend on the type of worker. Whether the type of the worker is heavy worker, sedentary worker, or moderate worker. For a male, it's always 54, and for female, it's always 46. And I told you for the pregnancy, the second trimester, third trimester, first trimester, nothing additional is required. And lactation, I told you 17 and 13, right? Tell me maximum protein is present in what? In the vegetarian diet. Maximum protein present in the pulses. And pulses may be best pulses soya bean. Soya bean is a type of pulse. Here out of the 100 gram, 43 gram is protein. Out of the 100 gram of soya bean, 43 gram is protein. Other pulses contain 22 gram of protein out of the 100. Fish contain out of the 100, 21. This is all out of 100. Meat contain 20 gram of protein. Egg contain only 13. Plus, please understand one thing here. There is 100 gram. 100 gram of soya bean contain 43 gram of protein, which is maximum. 100 gram of egg contain only 13. But still, I will say egg is the best source. You will say, ma'am, quantity wise, the soya bean is the best. Now, 13 is very less. है ना, ये भी 100 ग्राम है, ये भी 100 ग्राम है. इसमें 100 ग्राम में 43 प्रोटीन है और इसमें 100 ग्राम में ओनली 13 प्रोटीन है. So quantity wise soybean is good, I agree, but quality wise egg is good. Quality wise, so whatever we eat, it is not necessary it will absorb. जिसको जो absorb होगा, the protein which will absorb, that is useful for us. The protein which we are eating, it is not necessarily it is absorbing always. So here that is known as NPU, net protein output. So here NPU is less and here NPU is more. है ना, here NPU is only 50%. And here NPU is 100%. है ना? So here whatever you are eating, 50% of which is that absorbed. Here whatever you are eating, 100% is absorbed. So quality wise, the egg is good source. So if you ask me, ma'am, quantity wise, which is the best source of protein, and quality wise, which is the best source of protein. So here the answer is soya bean. Quantity wise, it's soya bean. It's not very good quality, only 50% of which is absorbed or less than that. Quality wise, the egg is the best source of protein, 100% of which is absorbed. The NPU is 100%. How many of you got this? How many of you got this? Okay, soya chunks are made up of soya bean only, Karthik. So of course they are also good source. Yes. So can we got it? Hannah? Yes, quality wise, egg is a good source. Why? Why, Elizabeth? Because NPU is 100%. What is NPU? Net protein output. It is the percentage of the protein, whatever we eat, how much it is absorbed. It is 100% is absorbed. Oh no. So please learn. Don't learn these figures. I'm not interested in the figures. I'm interested in the concept. So maximum protein, if you get this question, the maximum protein is present in, answer is of course soya bean. Hannah, if you are getting egg also as an option. So maximum is in soya bean. There is no doubt in that. But maximum absorbed, the answer will be egg. So little bit twist in the question can change the answer. Net protein output, NPU, that is out of whatever you are eating, how much percentage is absorbed. If I'm eating 100 gram, it is not all 100 will be absorbed. Maybe 50%, maybe 20%, whatever is absorbing. Sheikh, got it? Huh? So let's go ahead. I'm teaching you protein, everything about the protein. We have seen the requirement. We have seen the content wise, which food contain how much protein. Now protein is made up of amino acid. Let me tell you 5 type of amino acid. Everyone on the screen. You get many questions on that. The 5 type of amino acid. Let me tell you what are the 5 type of amino acid. Essential amino acid, non-essential amino acid, semi-essential amino acid, conditionally essential amino acid, and limiting amino acid. Let me explain the meaning. Okay. So essential amino acid. Essential amino acid, as the name indicate, these are essential in diet. You should eat it daily. है ना? So these are essential for your diet. These are not synthesized in the body. These are not synthesized in the body. You should eat it in the diet. है ना? In the diet, you should have it. So how many essential amino acids are there? There are 10 essential amino acids. 10. How many of them? There are 10. There is a mnemonic to learn that. The mnemonic is PVT. You know private कैसे लिखते हैं हम English में? Private PVT. Tim Hall. You can say PVT Tim Hall or private Tim Hall. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So say the full form. It's very easy. Phenylalanine, P for phenylalanine, V for valine, T for threonine, one more T for tryptophan, one I is for isoleucine, one M is for methionine. Okay, there is H for histidine, A for arginine, and there are 2 L, leucine and lysine. So there are 10 amino acids which are essential and you should eat them in your diet daily. because they are not synthesized in human body and you require them. So they should be supplemented in the diet. These are essential. Non-essential, acha, out of the 10, I have marked these two with different color. Why? Histidine and arginine. Why I have marked these with red color? Because these are not actually essential. These are, you can say, semi-essential. I mean, these are essential in children, not in adults. These are essential in children, but not in adults. Not in adults. Adults synthesize in their body. So adults, if they don't eat it, it's okay, but children should eat it. So that's why these two are highlighted with different color. Okay. Non-essential, they are synthesized in the body. You don't have to take them in the diet. Don't take them in the diet. They are already synthesized in the body, so they are non-essential for you. If you don't include them in diets, it's okay. It's okay. So I don't want you to learn this list. Remaining all are these. है ना, पीवीटी टिम हॉल को छोड़ के जितने भी बच गए हिंदी में कहूं तो वो नॉन एसेंशियल है. नॉन एसेंशियल की लिस्ट मत याद करो. एलेनाइन, आर्जिनिन, एस्पार्जिन, एस्पार्टेट, सिस्टीन, ग्लूटामिन, ग्लाइसिन, ऑर्थोनिन, प्रोलिन, सिरिन, टाइरोसिन. बहुत सारे हैं. Don't learn them. So out of them, they all are non-essential. Whatever left, total में से just reduce the essential. PVT, Tim Hall. अब उसको छोड़ के जितने भी बच गए, they are non-essential. The third are semi-essential. I already told you, histidine and arginine. I've marked with different color. Na? They are essential for children, but not for others. So these are semi-essential. The fourth are conditionally essential. Conditionally essential are वैसे तो non-essential. They are non-essential, but they convert into essential if their precursors are absent. Sometimes their precursors are absent, so they convert into essential. So it's tyrosin and cysteine. See, these are non-essential. Can you see here? Here you can see. In the non-essential, you can see this is tyrosin. One is tyrosin and one is cysteine. Where is cysteine? These two. So you can see these both are non-essential, but they will convert into essential if their precursors are absent. So you can learn CT. You can learn CT, cysteine and tyrosin. Okay, and last is limiting amino acid. What is limiting amino acid? Limiting amino acid is a particular amino acid absent in particular food. For example, cereal. What are cereals, by the way? Rice and wheat. I know, wheat. We eat roti, no? Roti is made up of wheat. No? Rice. So rice and wheat, they don't contain threonine. They don't contain threonine. Pulses matlab dal. Hindi mein kehte hain dal. है ना? Dal don't have methionine. And maize matlab bhutta. Have you seen maize? Let me show you. So you can see these are cereals. You can see these are pulses. Pulses is dal. And this is maize. Maize. है ना? Maize का आटा भी आता है. And maize matlab bhutta. है ना? In Hindi it is known as bhutta. So maize. In maize tryptophan is absent. How to learn that? How to learn? You get many questions on that. You can make mnemonic. है ना? Cereals का C. And threonine. So in C, T is absent. In cereals, threonine is absent. Pulses ka P. है ना? Pulses. In pulses, methionine, M is present, absent. In pulses, in P, M is absent. PM. CT, PM. In maize, tryptophan is absent. In empties, so empty. So you can learn CT, है ना? Pulses में methionine, PM. PM and empty. You can learn like that. It's a mnemonic. So in cereals, threonine is absent. In pulses, methionine is absent. In maize, tryptophan. These two are TT. How to learn that? Please learn. This is threonine. This is tryptophan. This is threonine. This is tryptophan. Okay. Okay. Got it? I will revise again, Aditya. Wait a while. Let me finish. Okay. So please learn what is deficient in what. So tell me what is absent in cereals. C में क्या absent होता है? T. है ना? T for क्या? Threonine. Okay. Pulses में क्या absent होता है? P for M. PM. Prime Minister. You can learn like that. Here methionine is absent. And maize में क्या absent होता है? MT. है ना? MT. यहाँ पे tryptophan. Tryptophan. This was threonine. This is tryptophan. So these two are different amino acid. Yes. Please learn that. Anna, you have to learn. So what I taught you the amino acids. We will revise all. All are important. Aditya, we have to learn all. Amino acids. Revise them. How many types of amino acids are there? Essential amino acid, non-essential amino acid, semi-essential amino acid. Okay. Conditionally essential. नाम में ही है. Conditionally. वैसे ही essential नहीं है, लेकिन एक condition हो जाएगी तो essential हो जाएंगे. Conditionally essential amino acid, and finally limiting, ultra important are limiting. If you can't learn or limiting, तो करना ही पड़ेगा. Limiting amino acid. Tell me the definition of all and then the examples of all. Essential are the one which we should eat in the diet because they are not synthesized in the body. Non-essential are opposite. They are non-essential. If you don't eat in diet, it's okay. It's okay because body take care of them. Body synthesize them. You can compare. Semi-essential are essential for children, but not for adults. That's why they are semi. आधे हैं, आधे नहीं है. आधी population में है, आधे में नहीं है. In half of the population they are essential. In another half they are not. Half means children में है, adults में नहीं है. Conditionally essential, actually they are non-essential, but they convert into essential if their precursor is absent. If the precursor is absent and limiting amino acid is absent in a particular food. Tell me the examples of all 5 category. Quick, fast. I don't have time. Quick, be fast. Okay, can you be fast? So essential amino acid is private PVT. TIM, 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 HALL Hall. Huh? Private TIM Hall, HALL Hall. Can we see the full form once? Phenylalanine, valine, threonine and tryptophan. Isoleucine, methionine, है ना? HC histidine, arginine, leucine, and one more L. Leucine and lysine. Okay. From that you have to mark H and A. This H and A. Can you see this H and A? Actually, these are semi-essential. H and A. है ना? Histidine and arginine. They are required only in children, not in adults. The same H. है ना? And here the remaining all are there. Don't learn the list. Remaining all. जितने भी बच गए वो सब इधर आएंगे. इसमें से 2, that is CT, है ना? Cysteine and tyrosine. Actually, they are non-essential, but their precursor is absent. They will convert into essential. Say yes. Got it? Huh? Lastly, limiting amino acid. Learn the 3 food. Cereal, pulses, maize. है ना? Cereal, pulses, maize. है ना? So, you can say cereals is rice and wheat, pulses is dal, maize is bhutta. What is absent in each of them? Tell me. Huh? Cereals are deficient of threonine. Pulses are deficient of methionine. And maize is deficient of tryptophan. This is TH, this is TR. How to learn? You please learn that. Got it? That's why we always mix dal chawal. Dal chawal is one of my favorite food. Many Indian eat dal chawal. है ना? Dal and chawal. I mean rice and pulses. Why we are mixing them? Because whatever is missing here is complemented there. Whatever is missing there, we complement there. So never eat only rice. Never eat only pulses. Better to mix the two. This is known as complementary action. What it is known as? Complementary action of the food. So whatever is missing in one is complemented in other. That's why our mothers always give you dal chawal. Hai na? They mix dal and chawal and give it to you. Huh? Dal and chawal. Because whatever in Indian diet, whatever is missing there, na, it is complemented there. So that's why we mix the 2 food together and we cook them together. इसलिए हमेशा से ट्रेंड है इंडियन फूड में कि दाल चावल साथ में ही बनते हैं घर में. है ना? तो दाल बनती है तो चावल बनते हैं, चावल तो दाल. It's या दाल रोटी. Again, the same thing. The roti is wheat. The wheat is deficient of threonine and pulses is deficient in methionine. So that's why dal roti, dal chawal. Got it? This is complementary action. How many of you got it? The summary is written in front of you. How many of you got it? We are done with protein. The 5 type of amino acid is also done and the protein requirement is also completed. We will solve some questions. People ready for the questions? Huh? The first question in front of you. Read the question. Tell me the answer. Limiting amino acid in wheat. Wheat is what? Wheat is a cereal. So what is limiting in that? Methionine and lysine, lysine and threonine, threonine and methionine, or arginine and lysine. I forgot to tell you, actually two things are missing. The main one I told you, but in cereals along with threonine, lysine is also missing. The second amino acid which is missing. You have to learn that also. See, the correct answer here is here. So threonine is there, you learned. The main one is the threonine which is missing here. But lysine is also missing. Lysine is also missing. है ना? So please learn. Try to learn both if you can. अगर नहीं भी कर सकते तो ठीक है. The main one you should learn. So main one is threonine. So this option is gaya. This option of threonine यहाँ और यहाँ है. So here methionine is not the answer, but lysine is the answer. This is how the approach you can approach. It's not C. The answer is B. Okay. The next question. Pulses deficient in which amino acid? Pulses. Pulses is dal. It's written like this. Dal. Pulses is deficient in which amino acid? Is it lysine, methionine, threonine, or tryptophan? I'm asking. Now you can get confused. Correct answer is methionine. Prime Minister, I told you. PM. Pulses are deficient in methionine. Pulses are deficient in methionine. So correct answer is methionine, and you all are right. Very good. Methionine and cysteine. Cysteine is the second one. Very good. Very good, Karthik. So if we can change the question, instead of pulse, if I do the maize, what is your answer in that case? Would you like to change your answer? Of course, you will. What is your answer in that case? Maize. What is deficient in maize? In maize, tryptophan is deficient. So in that case, answer will become D. If I change it to cereal, answer will become C. So if we keep on changing the question, the answer will change accordingly. Yes. Okay. So let's move ahead. Tell me conditionally essential amino acid. Conditionally essential amino acid are वैसे तो non-essential, but they become essential if their precursor is absent. Is it leucine and lysine, histidine and arginine, tyrosine and cysteine, or phenylalanine and tryptophan? I'm asking. Yes, you people are right. You people are right. The correct answer here is C. It's tyrosine and cysteine. These are the conditionally essential amino acid. वैसे these are non-essential, but they become essential if their precursor is absent. Okay, currently answer is C, not B. Many students are saying B. If I change it to semi-essential, would you like to change your answer? Instead of conditionally, if I say semi-essential. What is semi-essential? These are required in children, but not in adults. So what is the answer in that case? These are required in children, but not in adults. Semi-essential amino acid. What is the correct answer in that case? In that case, the correct answer is B, histidine and arginine. Very good, very good. Hannah? So in this way, you get many questions on that. The next question. Limiting amino acid in cereals and pulses respectively. So tell me what is the cereals, what is the pulses? Tell me the two options like that. In that sequence only. पहला cereals का deficient बताओ, दूसरा pulses का, respectively. So cereals is deficient of threonine and pulses is deficient of methionine. So threonine and methionine will be the answer. Hannah, so correct answer is C. Oh, the answer is marked wrong. I'm sorry. Hannah, this is wrong answer. Let me correct. I'm correcting. This is a typo mistake. So correct answer is C. Hannah, cereals are deficient in threonine and pulses are deficient in methionine. So correct answer is C. D is also correct, but lysine is the second amino acid which is missing here. I will not go with second if the first is given. Yeah, if this option is not given, I will go with D. Because lysine is also missing. Along with the threonine, the lysine is also missing. But this is the second one. The correct answer here is C. Okay, we are done with proteins. We are done with carbs. We are done with proteins. Now let me finish fats. The three macronutrients will be completed. Then we will come on micronutrients. Are you people there? Can we continue? Say yes. Huh? Can we continue? The fats. Okay, let's continue with fats. So that we are done with carbs. We are done with proteins, and now it's time to start the fats. Okay, proteins, you got it? We have seen the proteins also completely, the 5 type of amino acids, the limiting amino acid, the protein requirement, different food having different protein component, and quality wise maximum protein is present in, quantity wise maximum protein is present in. We have seen many things. Now it's time to start the fat. Okay, let's start fat. There are two types of fatty acid, saturated fatty acid and unsaturated fatty acid. How many type of fatty acids are there? Saturated fatty acids and unsaturated. What do you mean by that? In chemistry, you have read saturated means carbon having 4 valency, or the four valency is satisfied with hydrogen or other carbon. Unsaturated means double bond or triple bond. You know, this is saturated, this is unsaturated. Unsaturated means double and triple bonds are there. I guess everyone know. So there are two types of fats. Saturated fats, unsaturated fats. If unsaturated fats is there, it's double bond. But how many double bond? One double bond or multiple double bond? If one double bond is there, it is known as MUFA, mono unsaturated fatty acid. And if multiple double bonds are present, it's polyunsaturated fatty acid, PUFA. So it is of two types, MUFA and PUFA. Just suppose if multiple double bonds are there. So first double bond is on which carbon? Carbon number 3, it's known as omega 3. Carbon number 6, it's known as omega 6. And carbon number 9, it's omega 9. You know, it's a big structure. It's like बहुत ही complicated. It's a big structure. So number of carbon, है ना? So the third carbon is having double bond, or the sixth carbon or the ninth carbon. It's omega 3, omega 6, omega 9. The first double bond is present on which carbon? Say yes. So this is the classification of the fats. How many fats are there available? Tell me how many fats are available? Saturated, unsaturated. Unsaturated are how many types? The two types, MUFA and PUFA. What is MUFA and PUFA? It's monounsaturated fatty acid and polyunsaturated fatty acid. If it is PUFA, tell me the double bond is present on which carbon? Is it the third carbon, sixth carbon, or ninth carbon? Omega 3, omega 6, or omega 9? Got it? So that is the thing. The same thing. You have to learn. The examples in each category. Listen, which is better to eat? Which oil, cooking oil, you prefer in your home? Ask your mother which cooking oil you are using at your home. Is it soya bean? Is it safflower? Safflower, many people use. So safflower contains the safflower. Is it soya bean? Is it groundnut? Is it there are many oils available, and some people keep on changing that. So saturated are not at all good. The good for health is unsaturated. Unsaturated one are less atherogenic. They do not form the plaques. They do not get deposited and form the plaques and atherosclerosis. Unsaturated, we should eat unsaturated. Ab unsaturated, maybe we have two options. Now we should eat MUFA or PUFA. PUFA are much better. The more is the unsaturation, better is the fat, because less atherogenic it will be. Now we want a fat that should not deposit in our capillary and obstruct it. We want a fat that should be less atherogenic. You have seen the ad of the Saffola, है ना, दिल के लिए. They show the coronaries, like the fat which is blocking less coronary, that is good for you, है ना. So that is the thing. Okay, yes. So PUFA is good, of course. In the PUFA now, omega-3 or omega-6 or omega-9. I will come on that point by point. So omega-3 is better. We have to see the ratio, omega-3 is to omega-6. Omega-9 is not essential for human. Omega-3 and 6 are essential. So I will tell you the example. Saturated is not good for human. है ना? Saturated don't have any double bond. They are completely saturated. Example, palmitic acid, uric acid, stearic acid. These are not good for health. We should not eat saturated fatty acid. है ना? They are very cheap, because they are not good for health, but they are very cheaply available in the market. Now in the market, you eat all the fried food. I mean, how many of you eat the breakfast as a samosa, kachori, the typical Indian breakfast, है ना? And all the fried. So have you seen their pan? They have a black color oil in which they keep on frying the same kachori, samosa in bulk, and they provide it, है ना? You see that it's actually saturated fatty acid in which they are doing so, because it's very cheap. It's very cheap, but it's not good for health. Kabhi kabar is okay, but regularly it's not good for health. Okay, got it? That is saturated one. Coming on unsaturated, it is having one or more double bonds. So double bonds are present here. The double bonds are present here. Now it is of two types: mono unsaturated fatty acid and polyunsaturated fatty acid. Mono unsaturated fatty acid is MUFA, and polyunsaturated fatty acid is PUFA. MUFA and PUFA. Hana? MUFA example oleic acid. It's good, but best is PUFA. In the PUFA, we are having five type of fatty acids. I will tell you the 5 types of the PUFA. Okay, I will tell you. So PUFA have more than one double bonds. Now, where is first double bond? First double bond is on 3rd carbon, or it is on 6th carbon, or it is of 9th carbon. So we have seen the complete classification. Got it? The complete classification. Now you have to learn the types of the omega-3 and omega-6 is required. Omega-9 is not required. Omega-3, omega-6 is required. Learn the examples. In omega-3, the 3 examples are there. In omega-6 also we have many examples. In omega-3, the examples is alpha-linolenic acid. Can you please say it? It's linolenic. Can you please pronounce? Linolenic. In omega-6, it's linoleic. How many of you got the difference? This is linolenic. This is linoleic. This is alpha linolenic, and gamma linolenic is present in omega-3. We want alpha linolenic, not gamma. Gamma is not important. So linolenic and linoleic, these two are different, and you get many MCQs on that, and you get confused in the exam. You are getting it? What I am saying, omega-3 and omega-6. Along with that, omega-3 have 2 more amino acids which are present in fish. How many of you eat fish? Huh? The sea, the marine fish. It is present icosa pantenoic acid and docosa hexanoic acid. These are present in fish oil. These are present in fish. Okay, EPA and DHA. So alpha linolenic, EPA, DHA. These 3 are omega-3, the best one. The best one. And in omega-6 is linoleic acid, arachidonic acid. Gamma and this one is not required. How many of you got it? Say yes. Say yes. Okay. So what I told you, can I summarize? I told you fats. Till now, let me summarize. I told you fats. How many type of fats I told you? There are 2 type of fats. The saturated one, they don't have double bonds. And unsaturated one, of course, they have double bonds. The unsaturated one are much, much, much better than saturated. The saturated one, I told you, they are atherogenic. Atherogenic. They form atheromatous plaque in the coronaries, and chances of heart attack, MI, and diseases increase. We should not eat them. They are very cheap although, but we should not eat them. Unsaturated one are little bit costly, but they are better. They have double bonds. They have unsaturation. They are less atherogenic. Okay. Again, they are of 2 type, I told you. How many double bonds are present? Monounsaturated fatty acid, MUFA, or polyunsaturated fatty acid. So I told you more is the double bond, better is the oil. So PUFA are much better. In the MUFA, I told you only one example. Oleic acid. Okay. And in PUFA, I told you again, PUFA is of 3 type. Omega-3, omega-6, omega-9. Omega-9 is not required in human. Omega-3, I told you 3 example. Omega-6 also I told you 2 or 3 examples. So here it is linolenic acid. Alpha linolenic acid to be specific. And next is EHA and DHA, EPA and DHA, which are present in fish oil. Here I have told you linolenic. This is linoleic acid. And omega-6, it's linoleic acid along with arachidonic acid. How many of you got it? Anna? So this is the thing. This is the complete thing. You want more and more omega-3. Omega-3 and omega-6 ratio should be good. So you can see the same thing is written in front of you. So I want more and more linolenic acid. Maximum linolenic acid present in soybean oil. So soybean oil is the best one. Okay, linoleic acid present in safflower oil, corn oil, sunflower oil, and soybean oil. Hannah, you can see out of 100 how much is the percentage. Arachidonic acid present in meat, egg, and EPA, DHA is present in the fish oil. So you should have a mixture. You should not stick to one oil. Hannah, here virgin oil is not present. Yes, coconut oil, virgin coconut oil is not present here. So that is also good. Hannah, so many oils are present in the world. So you should take some month you should eat, consume one chance. So you should have a mixture of oil. Hannah, these all oils are good. I mean, they all have omega-3 and omega-6. These all are good. Okay, got it? Got it? Can we go ahead? So ideally, omega-3 is the best one. It reduces the chances of coronary heart disease because it is less atherogenic. That is the thing. Can we go ahead? Can we go ahead? Now I told you essential amino acid. What are essential amino acid? Can anyone tell me? What is essential amino acid? What is essential amino acid? The amino acid which has to be consumed in the diet which are not synthesized in human body. And that has to be taken in diet daily. That's why they are very essential for us. In the same way, we have essential fatty acid. The same meaning. We have to take them in the diet because body do not synthesize them. So they cannot be synthesized in the body. Most important is linoleic acid. Linolenic and arachidonic. These three are your essential fatty acid. If the deficiency of any one of them occurs now, the person have phrenoderma. Phrenoderma is this disease. Have you seen this? Someone is having like that. So if you are having this or any patient is having like this, it's looking like toad. What is toad? The frog baby larva of the frog. Can you see? The skin of the toad is like this, granularity. Appreciate the granularity, granule. Appreciate the granularity here. It is known as toad skin. It is known as phrenoderma. The phrenoderma. Phreno का मतलब होता है toad, derma मतलब skin. है ना? You can see phrenoderma, toad skin. That is the disease, and it occurs due to deficiency of essential amino acid, linoleic acid, linolenic acid, arachidonic acid, any one of them. If you don't eat in diet, this is the name of the disease. It is maximum in Kerala, Karnataka, and Gujarat in India, and that's why essential fatty acid and B complex treatment of you give essential fatty acid in the treatment. That's it. You got it? This is essential fatty acid. Can I go ahead? Say yes, say something. This is phrenoderma. You get an image-based question. It's a typical spotter. If this image is given to you like this, they can ask you two questions. Name the disease. Answer is phrenoderma. What is the cause of disease? Essential fatty acid deficiency. So name the essential fatty acid. It is linoleic, linolenic, and arachidonic. These three you should consume in your diet. Okay, and the soya bean, safflower, they all contain that. Okay, can we go ahead? The next is the hydrogenation. What is hydrogenation? I told you, the double bond. The more and more double bond, the better is the oil. If you provide hydrogen, what will happen? What will happen if you provide the hydrogen? You tell me what will happen. So all the carbon will get saturated with the hydrogen. In the chemistry, you read what is hydrogenation. This is hydrogenation. All the double bonds are broken and hydrogen will saturate the carbon valency. We know valency of carbon is 4. I do not want to teach you chemistry, by the way. Okay, this is known as hydrogenation. This is unsaturated carbon. I have done the hydrogenation and converted into saturated one. So I told you saturated is not good. So by doing hydrogenation, you are converting an unsaturated fat into saturated fat. Yes, the bonds are broken, obviously, by doing hydrogenation. So by doing hydrogenation, hydrogenated oil is not good. Hydrogenated is like it was initially unsaturated, but after hydrogenation, it becomes saturated. So have you seen this Vanaspati dalda? It looks like ghee because it's semi-solid, but it's not ghee. It's not ghee. So it's a ghee of poor. The poor person, ghee is the costly thing. So poor person cannot afford it. So they can eat Vanaspati, but it is not good oil. It is saturated one. It is saturated one which is created by hydrogenation. So unsaturated, when converted to saturated by hydrogenation, now they form like this. They form a semi-solid oil. The unsaturated, they are solid. They are liquids. When you hydrogenate them, now you add hydrogen in them, they convert into saturated. Of course, they will convert into saturated. So instead of liquid, now they become semi-solid. They look like ghee, but they are not ghee. So the saturated ones, which are semi-solid, they look like ghee, they are not ghee. This is the dalda. Got it, Hannah? So advantage is there. It can be stored in humid environment. Also, it is not liquid; it's semi-solid. But disadvantage is that it is containing more and more saturated one, and it is atherogenic. It's not good, Hannah. It's not good. Say yes. Okay. Usually, it is fortified by the government. The fortification is vitamin A containing how much vitamin A? 2500 international unit, and vitamin D is 175 international unit. Please respond. Got it? We are done with the facts. We are done with the facts. How many of you got it? How many of you got it? We will solve the questions after that. I told you everything about the fats. You want to revise it? I told you everything about the fats. There are two types of fats, saturated, unsaturated. Unsaturated have the double bonds. Anna, they are of two types, monounsaturated fatty acid, polyunsaturated fatty acid. Polyunsaturated again of three types. Where is the first double bond? Is it at carbon number 3, carbon number 6, or carbon number 9? You have to learn the example. Here, there, I told you many examples, not important, you can leave. Here, I told you only one example, oleic acid. Anna, in omega-3, I told you linolenic acid, alpha-linolenic acid. Anna, and here I told you linoleic acid. Linoleic acid and arachidonic acid. And here I told you two more, EPA and DHA. Anna, out of them, how many are essential, which we should eat in diet? These three are essential. 1 omega-3 and 2 omega-6. These are known as essential because we require them in diet. Daily we should eat them. They are not synthesized in the body. Remaining one can be synthesized in the body, right? Now omega-3 is the best one, right? So we have seen the composition, safflower, sunflower, how much each of them they contain. That's it. And deficiency of them leads to a disease. The name of the disease is Franoderma. That is the toad skin. Anything else? That's it we have seen till now. Now read the question, tell me the answer. Which of the following is a omega-3 fatty acid? Linoleic acid, alpha-linolenic acid, arachidonic acid, or gamma-linolenic acid? Tell me the answer. The question is a little bit tricky. I'm asking omega-3. Only one of them is omega-3. Yes, very good Pritesh. Very good Aditi. Very good Elizabeth. Alakesh. Everyone is good. Very good, very good. You all are good. Correct. So correct answer is alpha-linolenic acid. The remaining three are omega-6. They are also good, but the remaining three are omega-6. Linoleic acid is maximum in which oil? I'm asking linoleic, that is omega-3. Omega-3 is maximum in ground flour, safflower, mustard, or coconut. We want more and more and more omega-3, na? So maximum is present in safflower. What is the correct answer? I told you sunflower and safflower. So safflower is the maximum. Yes, safflower oil is the best oil among them. Okay. So coming on the next topic, we are done with fats also. We are done with carbs. We are done with proteins. We are done with fats. We are done with fibers. Before that, I told you what is balanced diet. Before that, I told you Indian reference male and female. This is the things we have learned till now in nutrition. Got it? Okay. What Karthik is saying, unsaturated is expensive. When it is hydrogenated, it will become more expensive now due to processing. Then how it become cheap? Just to, I don't know, Karthik, but it is a cheaper oil. It is a cheaper oil available in the market due to processing. Technically, you are right, but it is cheaper. It may be costly. You are right. Now, if you compare them with sunflower and safflower, maybe it is costly than as compared to that, Karthik. But according to ghee, it is cheaper. Ghee is costly, na? Ghee is costly. We are comparing the dalda with ghee. Anna, as compared to ghee, it is cheaper. As compared to ghee, it may be costly from safflower, sunflower. You are correct. But as compared to ghee, it is cheaper. Got it, Hannah? So people take it instead of ghee, but they shouldn't take it because it is not ghee. It looks like ghee, but actually it is not ghee. Only because of semi-solid state, they should not consider it. It is saturated one. Hannah, so real ghee is ghee only. Okay, so can we go ahead? So let's go ahead. The next topic is the glycemic index. What do you mean by glycemic index? Let me draw a GIT for you. Let me draw a human. Okay, this is the human. Okay, and this is the blood vessel. So whatever we eat in our diet, Hannah, it goes inside. From the intestine, it will get absorbed. It will reach in the blood. Hannah. So whatever carbs we eat in our diet, I'm interested in carbs right now, carbohydrates. Hannah, it will get processed and it will all the carbs, the polysaccharide will oligosaccharide convert into monosaccharide. The monosaccharide is the glucose. So whatever we eat ultimately get converted into glucose, and glucose in the blood rises after we eat. So whenever we eat, that thing will be absorbed and the glucose rise in the blood after eating. You will say, yes, ma'am, we know that. What is new in that? Now, whatever we eat, is it absorbed immediately and there is sudden peak of glucose in the blood? Is it the thing? Or whatever we eat, it is absorbing slowly and gradually the glucose is coming in the blood. That depends on glycemic index. Glycemic index, there are two type of food with glycemic index: high glycemic index, low glycemic index. Glycemic index is the time after which, after eating, in how much time the glucose raised in the blood. We thought, do you know that? I guess you all know that after eating we feel sleepy, है ना? Of course, तुमसे ज्यादा अच्छा किसे पता होगा, है ना? After the lunch, the complete class is like that, है ना? Drowsy. So why after eating we feel sleepy? Have you ever thought what is the scientific reason behind that? So whenever we eat, we have carbs in our diet. Whatever we eat in our lunch, dinner, we have carbs in that. Carbs are going inside. This suddenly absorb. If you are eating the food with high glycemic index, they will be suddenly absorbed, and suddenly the glucose in the blood will be more. So you have total 5 liter of blood in our body. We all have 5 liter, of course. So maximum blood is shunted in the intestine. Maximum blood is shunted in the intestine to take the glucose. There is load of glucose, abundant of glucose in the intestine, and intestine is keep on throwing the glucose in the blood. So all the blood is shunted in the intestine so that to take more and more blood, more and more glucose from the intestine. So brain receives less blood out of 5 liter, and that's why we feel sleepy. है ना? Brain को कम मिलता है ना? Out of the total proportion, intestine is receiving more and brain is getting less, है ना? So instead, you should eat the food with less glycemic index. Before exams, while you are classes, you should eat the food which is having less glycemic index. So you are not hungry. There is a filler. They will act like a filler, and gradually they will absorb. It is not suddenly absorbed, and gradually, slowly they will increase the blood glucose level. So it is not shifting of the blood to the intestine. So before your exam, which food you should eat? Before your classes, which food you should eat? The food having low glycemic index, not the food having high glycemic index. Got it? This is the reason. This is the thing, glycemic index. How fast the food is likely to raise the blood sugar level. That is the glycemic index of that food. There are two type of food, है ना? The high glycemic index, the low glycemic index. And a high glycemic index which suddenly cause a peak of glucose in the blood, and they have a plateau. They do not cause a peak. They gradually increase the glucose like a plateau. So glucose, cornflake, carrot, potato, honey, bread, millets, and rice, they increases the blood glucose suddenly, and you will feel sleepy after eating that. On the contrary, soya bean, groundnut, kidney bean, lentil, fructose, and rajma, they will increase the glucose gradually, है ना? And you will not feel sleepy after that. Say yes, say no. This is glycemic index. Can we go ahead? Can we go ahead? Respond, people. Okay. So please read the question and tell me the answer. Low glycemic index is seen in. You people are live now. No one is responding. That's why I'm asking. Low glycemic index is seen in. Low glycemic index is seen in which food? Cornflakes, brown rice, lentils, and white bread. So correct answer is lentils. The remaining two I told you in high, and lentils I told you here. You can see the lentils is having low, and the remaining all have high glycemic index. Okay. So coming on the next, cereals. The next thing is the cereals. We will see a few more, 15-20 minutes more. After that, we will take a lunch break. Okay. So the next is the cereals. There are three things in the cereals: rice, wheat, and maize. They all are deficient in one thing. Anna, the rice, wheat, I mean the maize is different. The cereals is deficient in what? The pulses is deficient in what? And maize is deficient in what? I told you the mnemonic CT, PM, and MT. I told you the mnemonic. CT, it's TR. No, it's TH. And M is TR. I told you this is threonine. Cereals are deficient in threonine. Pulses are deficient in methionine, and maize is deficient in tryptophan. I told you very clearly. So I'm teaching you cereals now. In cereals, I will teach you only one: rice. Rice ke bare mein sab. You know, rice is the staple food in India, especially in South India. Rice is a very staple food in India, South India. It is richer in lysine as compared to other cereals. All the cereals are deficient in threonine and lysine. But among all the cereals, the maximum lysine is present in the rice only. How much protein is present? 100 gram of the rice contain only 6.8 gram of protein. You tell me about the soya bean. 100 gram of soya bean contain 48 gram or 46 gram of protein. Here 100 gram of rice contain only 6. So protein cut is a very poor source. Rice do not give you protein. Hardly any protein it is giving you. Rice is a main source of carbs. It is giving you many carbs, not the protein. Hana? But whenever we get the rice, it's like this. It's like this from the plant, from the field. Hana? Khet mein se aisa milta hai rice. It is having a husk over it. Can you see the husk? The husk is the cover. The cover over the rice. Hana? We do dehusking and polishing. So first we do the dehusking, okay, and then we do the polishing. Then it converts like this, and then we eat it. Then we eat it. Okay, got it? So dehusking and polishing is known as milling of the rice. There is an instrument. This is a machine in which we do the milling. So this rice converted like this. So we are doing the dehusking, number 1, and we are doing the polishing, number 2, and finally like this we eat it. You will say, ma'am, we know that. So miling is good for us, but there is a problem during miling. Many things. So let me draw a diagram for you. So imagine this is a rice, and over the rice this is the husk of the rice. Let me draw the husk. In the husk of the rice, what I am saying, thymine is present, riboflavin is present, and a vitamin B complex, and protein is present. So when we remove the husk, all these things are lost. So that rice become nutritionally deficient, B1 deficient, B2 deficient, protein deficient. And when we eat the polished rice, now we can have beriberi because of the deficiency of the thymine. We do not want that. But we cannot eat the rice with the husk. Na? Chilke ke saath kaise kha le? We cannot eat the rice with the husk. We have to remove the husk. But we are removing the husk while mining. So there is another problem. Husk is taking the vitamin B complex, B1, B2 protein with that. And eating the polishing rice only, we can have beriberi. So what should we do? You got the problem? What should we do? So here comes the concept of parboiling. We should do the parboiling. What is parboiling? Partial cooking in the steam. So what we should do? We should take like this, a container. We should take water in that. Over the water, there is a perforated tray. It is having perforations. Now keep your rice over here. Keep all the rice over here. The husked rice. Husk walai. Before mining. Husked rice. And do the partial. Like here steam is there now. So on steam, you are doing partial cooking. On steam, you are doing partial cooking. It is known as parboiling. Partial cooking, not complete cooking. The husked rice. So by doing so, what will happen now? Whatever nutrition is present in the husk, that will go deeper. That will penetrate into the rice. So vitamin B1, B2, protein, that will penetrate deeper and go inside the rice. Now do husking. There is no problem. Already B1, B2 is penetrated inside. This is known as parboiling. So first do parboiling, then do mining. How many of you got it? First do what I said. First do parboiling, then do mining. Got it? Samjha kya? Huh? So first do parboiling. It is the partial cooking of the rice. It is a technique of preserving the nutritive value of the rice. By parboiling, the maximum vitamins and minerals, they present in the outer layer of the rice, they penetrate into the deeper layer. And then you are doing the mining. After that, you do the mining. So nothing is lost. So first do the parboiling. What is parboiling? Partial cooking in steam. It's a PYQ. And then do mining. What is mining? Dehusking and polishing. So first do parboiling, then do mining. Okay. So this is the process. This is the sequence. And why we are doing parboiling? To preserve the nutritive value of the rice. Because in the rice, many things are present in the husk. If we do directly mining and remove the husk, the rice will be deprived of many nutrition like riboflavin, thymine, B1, B2, protein will be lost, and the person can have beriberi. If without parboiling, we directly do the mining, such a rice person is eating constantly, the person will have beriberi. We do not want that. So first we will do the partial cooking in steam. Don't put it in water, put it in steam. Create steam in perforated tray and keep it for some time. So whatever nutrition is present in the outer layer, that will go deeper, and after that do the dehusking. So this is the complete thing. You get questions on that. This is how we do the parboiling. Parboiling plant is there. You can see here. So there is dryer, there is boiler, there is steamer, there is dryer. So there are many, and there is a fan. Multiple things are there. This is parboiling process. So this is the thing. You get question on rice. Rice pe do hi question aayega. Parboiling and mining. That's it. And rice is deficient in what? That's it. So read the question, tell me the answer. Who will tell me the answer? Parboiling means what? Cooking in boiling water, partial cooking in steam, miling process, or genetic engineering of the rice. I guess everyone knows the answer. Just now I taught you. What is parboiling? You all are right. Very good. It's partial cooking in the steam. And why we are doing that? To preserve the nutritive value of the rice. So that whatever present in the husk, the outer cover, that should penetrate deeper. And after that, if we are doing the dehusking, nothing is lost. Okay. Got it? Now, the next thing is the millets. What I am teaching you? Millets. What are the millets? There are 3 millets I am going to teach you now. Jowar, bajra and ragi. Okay, the another name of jowar is sorghum. The another name of bajra is pearl millet and ragi. These 3 are known as millets. These are small, small, small. Anna, you can see the small, small like millets. These are known as millets. Anna, so jowar, bajra and ragi. Please learn. These 3 are millets. I told you what are cereals. Cereals may there is rice, wheat and maize. These are cereals. You should know the category, which are cereals, which are millets. If you don't know even the category, how you can give the answer? So these 3 are known as millets. Okay. Now tell me, bajra among them having maximum things. So maximum protein in bajra, maximum fat in bajra, maximum carbs in jowar. है ना? We have 3 macronutrients, na? Carbs, protein and fat. So among that, maximum carbs is in bajra, maximum fat is also in bajra, but maximum protein is in jowar. है ना? उसके अलावा bajra में maximum energy. Overall, they all give energy. So maximum energy is also in bajra. है ना? Maximum iron is also in bajra. ठीक है? But maximum minerals present in ragi and maximum B complex present in jowar. You have to learn. Let me try. So what are the macronutrients? There are 3 macronutrients. Carbohydrate, fat and protein, and overall they all give energy. So tell me the maximum. Maximum carbs, bajra. Maximum fat, bajra. Maximum energy, bajra. But maximum protein is not bajra. Maximum protein is jowar. Hana, along with maximum protein, jowar also have maximum minerals. Okay, please learn that. Hana, maximum minerals. Apart from that, bajra have maximum iron also. Okay, maximum carbs, jowar. Okay, I got, okay. I'm sorry, I have done a mistake. I'm sorry. Got it, Aditi, got it. Hana, carbs was maximum in jowar. Let me write it again. Okay, got it, Karthi, got it. So let me write it again. Carbs is maximum in jowar. Okay, along with the carbs, okay, iron, energy, B complex. Very good. So we will write it again. Okay, so there are 3 things: macronutrient, carbs, protein, fat. Now I will be right. Protein maximum in bajra, fat maximum in bajra, energy maximum in bajra, but carbs maximum in jowar. This time I'm right, I guess. Not only this, jowar also contain maximum B complex. Okay, carbs and B complex. ठीक है? And in bajra, 3 things are maximum: energy maximum, protein maximum, fat maximum, and iron is also maximum in the bajra, right? And along with that, ragi, only one thing: calcium. Ragi is calcium. So howsoever learn, please learn that. Read the question, tell me the answer. Highest fat is present in. Highest fat is present in. Fat, rice, wheat, bajra, jowar. Fat. I'm asking fat. Yes? What is the correct answer? Waiting. So yes, the correct answer is bajra. Instead of fat, if I ask the protein again, answer is again bajra. Okay, but instead of that, if I ask the carbs, answer will be jowar. Okay, so you get questions, simple questions on the millets. Coming on the next pulses. We have seen the protein, carbs, fats, cereals, hana, millets. Now it's time to study the pulses. Can I start the pulses? How many of you are with me? Can I start the pulses? How many of you are with me? Pulses. Pulses is known as dal. In Hindi, it is known as dal, like that. All the dals. Hana? So it is having more protein than egg, than fish, than flesh. It is having maximum protein. Hana? Pulses. So for vegetarian, the maximum source of protein is in pulses only. Okay, but they are inferior in quality. I told you, maximum quality wise, the maximum protein is in egg. But quantity wise, it is in pulses. Which pulse? Soya bean. It is in soya bean. So it contains 20 to 25% of the protein. It is in soya bean. Okay, I told you pulses are deficient in methionine. Prime Minister, I told you the mnemonic. Pulses are deficient in methionine and cysteine also. But they are rich in lysine. The lysine is deficient in cereals. They are rich in lysine. Okay, soya bean is the best pulse. It is having highest nutritive value. See the diagram. It is having 100 gram have 43 gram of protein out of 100. Out of 100, if you take 100 gram of packet, it have 43 gram of protein. Usme 43 to protein, yeah, nearly 50% or 40% is protein. Apart from that, calcium, iron, vitamin B complex, is also present, but NPU is only 50%. What is NPU? Net protein output. Whatever you eat, only 50% is absorbed. So if you are eating 100 grams of soya bean, you assume you should get 43 grams of protein, but you will get only 21 gram, the half of that. Because whatever you eat, it is not 100% absorbed. You eat only 50% is absorbed. So quality is not very good. Quantity is good, but quality is not very good. You got it? Say yes if you got it. Huh? So highest calories among the pulses is soya bean. Highest protein is soya bean. Highest fat is soya bean. Highest iron is soya bean. Highest vitamin B1, B2, it is in soya bean. Okay, so all the things are maximum in soya bean among pulses, except maximum calcium is in horse gram. It's a type of dal. It's a type of pulse. Maximum niacin is present in dry peas, and maximum vitamin C is in Bengal gram. If you want to learn, it's purely rectification. I know, but I'm trying to make the things easy. Okay, read the question. Maximum protein. They all are pulses. Gram, 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 and soya bean. They all are pulses. So among the pulses, which pulse have maximum protein? I told you the answer. It's soya bean. Everything among the pulses. Ye hai pura among the pulses. And I told you the same story among the millets also. Among the millets, that is bajra, jowar, and ragi, which is maximum in what? Among the pulses, which is, so everywhere soya bean is number one, except calcium is maximum in horse gram. Horse gram is a type of dal. I guess you have re-eat it. Or maximum niacin is present in dry peas, and maximum vitamin C is Bengal gram. Rest all maximum is soya bean. So I hope you all are right. The correct answer here is soya bean. Huh? Can we go ahead? Can we go ahead? Okay. Huh? Say yes, say no, say something. Okay. So can we take a break now and continue after that? So we have to complete this nutrition after the. And many important topics. I will come on fluorine. After that, the minerals will be done. Then I will come on all the vitamins. Vitamin A, B, C, D, B complex, everything. All the vitamins we will see and their details you will see. Not only this, after that, I'm having food adulteration. The 5 type of food adulterants I will teach you. Food supplementation I will teach you. There are many things to be covered here. Maybe 1 hour or 1.5 hours. 1 hour at least we require for nutrition. And after that, the third and biggest unit, I will take one more after that. Preventive obstetrics, preventive pediatrics, and geriatrics. We will take that. So we will complete this also. And I don't think we will be able to do screening of disease today. I do not want to compromise the quality. We will do 100%. We will go slowly, but we will do 100%. Let's see if we can cover this also. It's good. If we can't cover, it's a small topic. It will take 1 hour, but we can take tomorrow morning then. So today, after lunch, first priority to complete the nutrition as soon as possible. And after that, preventive obstetric and pediatrics and geriatrics wala chapter. It is also, so 3 big chapters will be done today. Okay, got it, Anna? So this is the thing. This is how we will go one by one. So how much time you require for the lunch? It's 2:15 right now. 2:15 right now. How many minutes? Can we start at 2:50? 35 minutes? After 35 minutes? 1 hour. 45 minutes. You require 45 minutes. Can we start at 3 then? Can we start at 3? So non-stop we will take till evening then. 3 to 5, 5:30 or maybe 6. 3 to 6 we will take. So 1 hour we will take nutrition and 2 hours we will take obstetrics. And we will finish it for today. Okay, 3 p.m. sharp. Okay, I will come 5 minutes before only. If you require 5 minutes to settle. So please join 5 minutes before. Okay, so I'm ending this link. You will get another link. So at 3 o'clock, whatever group you follow for NLC, the team, technical team will provide you another link. I'm ending this. Bye-bye. 3 o'clock sharp. Everyone be on time. Bye-bye.